England in 1960s. This is a type of increased maternal mortality in hospital delivery. This is a spurious or a false association. Increase of altitude leads to goiter. Increase of altitude leads to goiter. This is a indirect association. Indirect association, because as altitude increase, iodine deficiency becomes progressively in the soil. Very right. This is which model of disease causation? This is web of causation given by McMahon and Pugh. What is the major purpose? What is the major purpose of web of causation? Single answer. Yes, it is not to find the multiple risk factors. We are trying to see how they are related to each other, and then it tells you possible places of intervention. Possible places of intervention. Very good. Then can you tell me who is 1, 2, 3, 4? 1, 2, 3, 4. 1 is Edward Jenner. 2 is John Snow. 3 is Louis Pasteur. 4th is James Lind. Can you tell me contribution of 1 Edward Jenner? Yes, smallpox vaccine. First vaccine to be discovered. And he gave the term vaccination. Term vaccination. John Snow. He is father of epidemiology. Father of modern epidemiology. Worked on the disease cholera. Cholera came to be known as father of public health. He used spot map. He used natural experiment study design. And that was gum boots or shoe leather epidemiology. Minimum you have to know. Louis Pasteur, contribution. Pasteurization of milk. Term vaccine. He discovered and developed rabies and anthrax vaccines. He gave, or he died in which country? Germ theory of disease, yes. He died in which country? Older question. France. James Lind, exact contribution. He did not discover vitamin C. He did not discover scurvy. What did he discover? James Lind ने ना vitamin C discover किया ना scurvy discover की. He discovered that scurvy is preventable and treatable to an extent using citrus fruits. Vitamin C and scurvy relationship was discovered many years later. Now, 2 questions just for my sake. Remember that Edward Jenner died in the year 1823 and John Snow died in 1858. Very old questions of FMG. I will not ask you to remember death years of all the 2030 scientists, but ये दो याद करके जाने हैं. Edward Jenner 1823, John Snow 1858. Can you tell me answer to this question? When we look at vaccination, all of the following are examples of passive immunity except. Why you are saying C? Because actually when we look at vaccination, they are active immunity. So vaccines and natural infections provide active immunity. Antibodies in the form of immunoglobulin, antitoxin, monoclonal antibody, they are passive immunity. Mother to child transmission of antibodies is also a passive immunity. Yes, active is time consuming to form, but it is long lasting. Passive is immediate, but it disappears also very fast. Right. Open vial policy, can you tell me, is applicable on which vaccines? It is applicable on T series of vaccines. T series means DPT, DT, TT, TD, and pentavalent also. So let us include pentavalent also, which includes HIV also. It is also applicable on OPV, IPV. It is also applicable on pneumococcal conjugate vaccine. It is not applicable on which group of vaccines? Yes, let's call them lyophilized vaccines. Lyophilized means freeze-dried vaccines. Freeze-dried means powder vaccines. So BCG, measles, MR, MMR, Japanese encephalitis, COVID vaccines. Now, if I say this is rotaviral vaccine, I say this is rotaviral vaccine, which is having open vial policy applicable. Applicable is when it is on the side of the vial. If VVM is on the cap of the vial, it is not applicable. If you have to mark single answer, if you have to mark single answer, suppose they don't tell you about VVM on cap, VVM on side, then it is applicable. Older stock of VVM on cap is slowly disappearing from the country. Only VVM on the side will now be available in the country. Right? Okay. Right? Okay. नहीं comment section कैसे बंद कर देंगे भाई? If we shut down the comment section, how will I come to know what are your issues? If you're not understanding a thing, I will then discuss, right? इसलिए तो live है, otherwise तो I would have recorded and put it on the app. Open vial policy is applicable for how long? Open vial policy is applicable for 28 days. In National AIDS Control Program, which activities carried out for 28 days? Random question. In National AIDS Control Program, which activities carried out for 28 days? सब सोच में पड़ गए? Yes, that is post-exposure prophylaxis with 3 drugs. Post-exposure prophylaxis, right? Good. Now, can you tell me which is killed vaccine out of these 4? Although it is written on the screen, but just let's quickly look at it. Covaxin. What is the strain of Covaxin? National Institute of Virology 2020 770. Can you tell me which of them are indigenous vaccines? 100%. Although it is written on the screen, but I want you to remember indigenous are these 2. Which of them can be given to children below the age of 15 years? Is Corbevax. What is the unique feature of Corbevax? Anyone? What is the unique feature of Corbevax? Anyone? नहीं नेजल नहीं है भाई, कॉर्बीवैक्स तो इंट्रामस्कुलर है. Yes, you are right. Heterologous booster dose to other vaccines. Incovac is intranasal. Can you tell me which of them have thromboembolism as the major side effect? One of the side effects. Yes, Covaxin. Can you tell me which has been received by majority of population of our country? Covishield, Covaxin, Corbevax, Incovac. So thromboembolism, Covishield, and Covishield only is most common. 95% of immunizations in the country were through Covishield only. Very right. When do we give vitamin A in the schedule? How many doses? Total dose. It is started at 9 months, then every 6 months till the age of 5 years. It is given in a total dose, नहीं 50,000 नहीं होता, in a total dose of 17 lakh international units. So we have 9 doses. Now, when you look at its plastic white colored spoon, if they show you in the image, inner margin 1 ml. This is for 1 lakh international units. And 2 ml outer margin is for 2 lakh international units. Can you tell me if a vitamin A bottle is opened today, how long we can use this bottle? Good, Dr. Sumant is right, 8 weeks. Can you tell me at which temperature vitamin A should be stored? At which temperature vitamin A should be stored at a primary health center? It is room temperature. Which level of prevention this is? Which level of prevention this is? Primary. All vaccines. This is not a vaccine, but it is a part of immunization schedule. It is primary level. Risk factor is present in the country. Very good. Ice-lined refrigerator, which is kept at PHC. Temperature of all the vaccines is 2 to 8. Can you tell me storage duration, minimum electricity, and without electricity it can maintain up to? Storage duration is 1 month, 8 hours a day, up to 5 days it can maintain. Can you identify what is shown at the bottom? This one. And what is the principle and frequency? This is dial thermometer. Cold chain temperature monitoring of a ice line refrigerator at PHC. Principle, it is a thermocouple. What is the frequency of monitoring? Once a day, twice a day, once a week, twice a week? It is twice a day. Dial thermometer. Good. Can you tell me, vaccine carrier, how many vials, how long we can store? In vaccine carrier, because of fully frozen ice packs, total 16 to 20 vials can be stored for 12 to 24 hours. Can we keep it overnight at sub center? Can we keep it overnight at sub center? Yes. If you have given BCG, mother tells you scar formation did not take place on the left deltoid, skin above left deltoid. You will reassure the mother. Nothing else is required. Scar formation is not mandatory. Please remember, scar formation is not mandatory. If mother tells you, okay, suppose a mother tells you after 5 years that child received BCG at birth, how will you confirm? Simple clinical question. Mother tells you child received BCG at birth, you want to confirm. One is immunization card. Suppose immunization card is not there. BCG scar. Suppose scar is not there. Now how will you confirm? No, not Montu test. How will you confirm? No, 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 not at all. You just have to think logically. मदर के पास कार्ड नहीं है. You just have to confirm then and there only. उसी वक्त confirm करना है. अरे इम्यूनोग्लोबुलिन कहाँ टेस्ट करेंगे भाई प्राइमरी हेल्थ सेंटर पे? What will you ask the mother? This is what I am asking. You will ask the mother, was there any injection given at birth? If she says yes, simply ask where. If she points here, that means child has been given BCG. So this is how we actually confirm. Very easy to confirm. If she says कि बच्चे को हाथ पे लगाया था टीका, that is a confirmation that the child actually got BCG vaccine. If it is given by mistake on the right side, nothing to worry. No harm. By convention, intradermal left half, subcutaneous right half. Can you tell me SN regimen and Thai updated Red Cross regimen of rabies vaccine? SN regimen, which is intramuscular, it is given as 1 dash 1 dash 1 dash 1. Thai updated Red Cross intradermal 22202. Intramuscular is given in deltoid. Can you tell me where intradermal is given? Suppose they show you a human body, let us say. They show you an image like this. Where is rabies vaccine given? भाई रेबीज वैक्सीन मैं पूछ रहा हूं इंट्राडर्मल, नॉट अराउंड द वुंड. रेबीज वैक्सीन भाई वैक्सीन. हाउ कैन यू मार्क दिस आंसर रॉन्ग? रेबीज वैक्सीन डेल्टॉइड नहीं भाई. डेल्टॉइड में स्किन अबव डेल्टॉइड ओनली यू गिव बीसीजी. डॉक्टर मोहम्मद आसिफ इज राइट. स्किन अबव द जॉइंट्स ऑफ अपर लिम. तो या तो दोनों शोल्डर पे दे दो, या दोनों एल्बो पे, या दोनों रिस्ट पे. आई विल रिपीट. इंट्रामस्कुलर rabies vaccine is given in deltoid, but intradermal vaccine is given in skin above joints, upper limb. तो शोल्डर बेस्ट होता है. 2 डोज देने हैं ना, 1 ऑन राइट 1 ऑन लेफ्ट साइड. ह्यूमन रेबीज इम्यूनोग्लोबुलिन डोज, वेयर विल यू गिव इट? Human rabies immunoglobulin is 20 international units per kilogram, and it should be given 100% around the wound. How long will you wash wound with soap and water? It is 15 to 20 minutes. Running water होता है. Suturing should not be done. Local antiseptic should be given. Antibiotic should be given. Which antibiotic are we talking of? Which antibiotic? Yes, amoxicillin clavulanic acid combination. Another, all we are discussing are your and NEET PG exam questions. Can you tell me if I have missed anything in this list? When you are looking at a case of dog bite, anything I have missed beyond vaccination, immunoglobulin, and these 4? So let us say vaccine, immunoglobulin if required. What is missing? Yes, Dr. Dulam is right. It is tetanus toxoid. That should also be given. That should also be given. Will you give rabies vaccine in a case of human bite? A rabies person bites a healthy person. Should we give rabies vaccine? Answer is no. Can it be given in a rat bite? RAT rat bite. सिर्फ आइकेनेला नहीं होते, 5 हेसक ऑर्गेनिज्म होते हैं ह्यूमन बाइट में. Rat bite also it is not given. So human bite and rat bite rabies vaccine is not required. Rat if it is domestic or peri-domestic. If it is a wild rodent in forest, then definitely rabies vaccine should be given. Rabies or HPV, one of these vaccines will definitely appear in your exam. Now, can you tell me which is the most common type of HPV responsible for cervical cancer? Yes, 1618. Therefore, it is present in all the vaccines. Can you tell me out of 1618 which is more common? इन दोनों में कौन सा ज्यादा कॉमन है? Out of 1618 is 60. Now, please remember, Cervarix is bivalent, Gardasil is quadrivalent. But Indian vaccine, Cervavac is quadrivalent. What is the problem with HPV vaccine that many state governments have started recently in national immunization schedule? What is wrong with that? They are giving single dose. Whereas for quadrivalent vaccine, it is recommended minimum 2 doses should be given. So single dose will definitely not give high degree of protection, but at least they are giving, right? Okay. Vaccine vial monitor is an indicator of what is the chemical used. Vaccine vial monitor is an indicator of cold chain maintenance. And what is the chemical used? Earlier we were using p-toluene sulfonate. Now we are using diacetylene. Arrange the following in correct sequence. Is ABCD the correct sequence? No. So what is the correct sequence? Yes, very right. B, D, C, A. Which of them are usable? This is how applied questions will come in your paper. Which of them are usable? Yes, B and D. If inner square is lighter than the outer circle, use the vial. If it is of the same color or darker color, discard the vial. So, vaccine vial monitor. Can you tell me which vaccine leads to Guillain-Barré syndrome? Which vaccine leads to paralysis? Guillain-Barré syndrome is due to killed influenza vaccine. So they will make a long story. A child came to your PHC, you gave him some vaccine. After 20 days, he came with GBS. It is killed influenza. Vaccine associated paralytic polio. Most common cause is P3. But what about vaccine derived polio virus? So, vaccine associated paralysis is due to OPV. Vaccine derived polio virus is community subtype of P2 virus. Toxic shock syndrome, Staph aureus, vaccine is measles. Which contraceptive leads to TSS? Which contraceptive leads to TSS? Contraceptive. Diaphragm and vaginal sponge. I told you in the class also, many of you are saying tampon. Tampon is not a contraceptive. In the exam, you have to read the question carefully. My question was which contraceptive leads to TSS, right? Okay. Shock and hypersensitivity are seen due to shock and hypersensitivity are due to hepatitis B. So they will give a long statement. 14 weeks old child comes to your clinic. When you are giving the vaccine, suddenly child develops hypersensitivity reaction and goes into shock. Vaccine most commonly responsible has to be hepatitis B. Which screen is smaller? Okay, just a second. Let me drag it. Okay. Okay, this is fine. Okay. Now, which of the following vaccine is given as a part of school immunization program? Just read carefully. Read carefully. What should I mark as the answer to this question? Now, why you are saying TD vaccine? What is the reason behind this, friend? TD vaccine is given at what age in the country? A question of FMG. 10 years. Only 10 years. 10 and 16 years. Is it given to someone else also beside 10 and 16 years? TD is also given to pregnant females in the country. Very right. Serology of IPV vaccine. FMG question again. Is IPV is trivalent? What about OPV if they ask you? Oral polio vaccine. It is bivalent. What is the answer? Choice number B. It is type 1 and 3. When we shifted from trivalent OPV to bivalent OPV, that program was known as switch program. 25th April 2016. Can you tell me health and disease which answer is correct? This question many students attempted wrongly. Please take your time. Do not be in a hurry. Mark correct answer. Yes, still you can see we are having different options in the chat box. Many are saying B, many are saying C. HDI includes literacy rate. It includes income. Income can be measured as gross national income per capita or purchasing power parity. And it includes life expectancy at birth. Friends, if you have marked this question wrong, which around 20% students did in the chat box, you have to go through all the PYQs of your exam and if possible NEET PG of last 3 years. Read the question carefully. Such an easy question, we cannot go wrong. Can I say it is based on health, education and living standards? Yes, it is based on health, education and living standards. What is complementary to Human Development Index? What is complementary? इससे बिल्कुल उल्टा क्या होता है? Poverty. Very right. What is the poverty cutoff in rural areas, urban areas based on calorie consumption per day? Yes, 2400 kilocalories, 2100 kilocalories per day. If a person is not able to afford these many calories, he or she is a poor person. Take your time. Level of prevention. In the exam, see, when this question came, many students didn't read the question properly. They are asking you two different things. When you are looking at screening, you are trying to find a disease. So this is secondary. When you are looking at counseling, TB and HIV positive, we know most common opportunistic infection of HIV in the country is TB. HIV positive comes. Now you're counseling him how you can prevent TB. So this is primary level. So answer is choice number B. If you got this wrong, you have to go through PYQs, right? We don't have time for concepts. Go through the PYQs. Go through the PYQs properly, right? Okay. Now, can you tell me measles vaccine and rabies? Okay, measles vaccine is which level of prevention? Measles vaccine is primary specific protection. What about rabies vaccine post exposure? Rabies vaccine after exposure. Many of you are writing wrongly. It is secondary. No. Rabies vaccine cannot treat rabies. It is after exposure. Again, primary. So let us remind ourselves of the rule we discussed in the class. All vaccines are primary level specific protection except when BCG is used in bladder cancer for treatment, it becomes secondary. Spectacles is which level of prevention? Spectacles. Tertiary. Which mode? Disability limitation, rehabilitation, both. It leads to both. Disability limitation plus rehabilitation. Category 2 dots. Category 2 dots. Dots directly observed treatment. So this is secondary. Monitoring of blood pressure. Monitoring of blood pressure. Yes, you are trying to detect hypertension. Secondary. Source reduction. Source reduction. Primordial. No water accumulation, no mosquito breeding, no malaria. Preserving traditional lifestyle. Preserving traditional lifestyle. Primordial. See, what is traditional lifestyle? No one is smoker from birth. No one is alcoholic from birth. Preserve that. Changing lifestyle. Changing lifestyle. Primary. If I'm asking to change your lifestyle, that means I find something wrong in your lifestyle. So that will be primary. Seatbelt helmet. Seatbelt helmet is primary. Risk is present. You are driving a bike. So that will be primary. Fetal ultrasonography. Fetal ultrasonography. Secondary. You are detecting Down syndrome. A father asked his son to leave his bad habits. A father asked his son to leave his bad habits. Primary health promotion. Son leaves bad habits on advice of father. Son leaves bad habits on advice of father. Primary specific protection. Friends, this is the first topic today where a lot of you are giving wrong answers when I'm asking the question. You have to go through this topic. One question will 100% come in your paper. So please go through this topic quickly from the mission classes. Watch it at a higher speed. In 15 minutes, you will be able to cover that 30-40 minute video, right? Okay. No, confusion will not be. Let me again revise, Dr. Deepthi. Primordial is before risk factor. Primary is after risk factor. Secondary is early part of disease. Tertiary is late part of disease. Just go through the definitions. Read all the 40-50 examples we discussed in the class. It will become easy. Don't worry. Right? Okay. Such a easy question came last time. This is your FMG question. Last exam January. 1,000 women screened for breast cancer, then given treatment. When I look at screening, early detection, treatment, easiest question. They will make questions very lengthy. Answer will be very easy. Who is a pseudo carrier? एंटी बैन टेलीग्राम इज प्राइमरी लेवल ऑफ प्रिवेंशन. रिस्क है इसीलिए तो बैन किए. दिस इज ए विरुलेंट ऑर्गेनिजम्स. Cockroach is a pseudo carrier. They don't transmit the diseases barring few organisms, very few organisms. Who is a index case? Who is a index case? भाई ये जोक नहीं था, ये रियलिटी है दैट कॉकरोच डू नॉट एज सच ट्रांसमिट डिजीजेस बारिंग वेरी फ्यू, वन और टू मे बी fecal. Yes. First case coming to notice of investigator. Serial interval is interval or gap between dash and dash. Can anyone tell me? Good. All of you are right. Primary and secondary cases. See what I'm seeing, most of the definitions, 100% of you are correct. But when question becomes slightly applied, many of us face problem. So just read the question carefully in the paper. One liner answers. Finish fast, move forward. But lengthy questions, if there is a need, you can read. बट टाइम का ध्यान रखना भाई, एग्जाम में ऑटो सबमिशन है स्लॉट्स का. ऑल ऑफ यू आर अवेयर देयर आर स्लॉट्स इन योर एग्जाम विच गेट्स ऑटो सबमिटेड. Okay, everyone is aware. Good. Submerged portion shows which disease? Can you tell me? Yes, influenza. Why not first three? Because these three do not show iceberg phenomena along with two more diseases. Which two other diseases do not show iceberg? Yes, it is rabies and pertussis. Best iceberg phenomena, even better than influenza, is shown by malnutrition. Very good. Which type of epidemic this is? Sudden rise, sudden fall, clustering of cases in one incubation period. Single exposure point source epidemic. Bhopal gas tragedy, Chernobyl tragedy, Vizag tragedy, food poisoning are good examples. But if you have multiple peaks known as secondary waves, this is multiple exposure point source epidemic. For your June FMG paper, please remember multiple exposure epidemic is also known as continuous exposure, repeated exposure epidemic also. Example could be like contaminated well. But if it is slow rise, slow fall, propagated. person to person transmission. Tuberculosis, one case give rise to 10 to 15 cases in a year, right? HIV, HIV will be which type? HIV, propagated. HIV through a commercial sex worker. HIV through a commercial sex worker. Multiple exposure point source. Very good. Can you tell me which diagram is this? Can you tell me which diagram is this? Yes, natural history of disease. Question was in such a lengthy question, what indicates the onset of symptoms? It is such a easy question of your paper. Onset of symptoms mark clinical disease starting in the body. So here, answer is C. So we have susceptibility, then pathogenesis, then symptomatology, signs, symptoms appear, and finally recovery, disability, or death. Natural history of disease is without intervention. Okay. Now this is a clinical applied question where you are asked to do calculation. Can anyone tell me what is the denominator of incidence? Incidence of a disease is new cases. But my question was what is denominator? Very old question of FMG. नॉन एक्सपोज्ड नहीं भैया इंसिडेंस का फॉर्मूला पूछ रहा हूं डॉक्टर कृष्णा इज राइट ओनली वन स्टूडेंट हैज आंसर्ड करेक्टली दैट इज पॉपुलेशन एट रिस्क into 1000. Now when you read this question you will find on 1st January 100 already have tuberculosis. By complete 1 year 20 new cases occurred. So 20 new cases out of total population 10,000 into 1000. So that gives you incidence of 2, which is because multiplier is 1000 expressed per 1000 population. Look at prevalence. See, I know many of you have memorized the answer, but this question may come with changed values also. Prevalence is new plus old cases out of total population. Here multiplier is 100. It is a proportion expressed as a percentage. So when we look new cases 20, old cases 100 out of 10,000 population into 100. So that is total of 120 out of 10,000, 1.2%. Now when I say 1.2%, it is 0.012. Please remember in this particular question, students were given cures and deaths just to confuse. When you are looking at incidence prevalence, you only check how many new cases, how many old cases. We don't look at how many of them subsequently were cured or died. This you have to remember, right? So new cases and total cases in the population. So incidence prevalence calculation comes, please mark correctly. Incidence is a rate, prevalence is a proportion. Screening. Can you tell me what is the diagnostic test for tuberculosis in the country? What is the diagnostic test for malaria and for HIV? Tuberculosis, we diagnose by sputum smear, acid fast bacilli, using ZN stain. We can also use other tests like CBNAT, automated liquid culture, line probe assay, and many more tests are used. Malaria, peripheral blood smear. For malarial parasite, what is the name of the stain? Jaswant Singh Bhattacharya. In India, like for TB, I am saying we use CBNAT also. In malaria, we have rapid diagnostic kit also. Rapid diagnostic kit. What is the antigen used in dipstick test of malaria? Random question. What is the antigen used in dipstick test of malaria? Histidine rich protein type 2 Plasmodium falciparum. Many of you are answering RK39, which is wrong. RK39 is used for Kala-Azar serological diagnosis. Malaria is histidine rich protein type 2 Plasmodium falciparum. एग्जाम में जल्दबाजी नहीं करनी है. टुडे वी आर डूइंग मैराथन सेशन, देयरफॉर इट वी आर गोइंग फास्टर, राइट? ओके. HIV diagnostic test is Western blot assay, which is a protein based test. What is the screening test for HIV in the country? We use ELISA rapid and simple, together known as ERS battery. Breast cancer screening test. Single answer. Mammography. In younger females, which is the best test to screen? Younger females. MRI. Cervical cancer screening. One answer I want. One answer. गलती नहीं करना है. Pap smear is not correct. Many of you are writing wire test. So wire test is the number one test, most cost effective, easily usable at subcenter PHC also. HIV DNA we don't use as the primary test in the program. Indian program we are talking of PSM wise Western blot assay. Yes, Pap smear is also done, but wire test is more easy to do, more cost effective. Therefore, it has replaced Pap smear. No, with not 95%, with 5% acetic acid, not 95%. Visual inspection of cervix with 5% acetic acid. Identify the test. What is the cutoff? What is it used for? Oral glucose tolerance test, diagnosis of diabetes, where 2 hour venous plasma glucose cutoff is 140. कहां से आ गया भाई? ये तो FMG का क्वेश्चन है. हाउ कैन वी गो रॉन्ग? More than 200 milligram per deciliter. So look at the screen. 2 hour cutoff more than 200. So when I look at patient number 1, green 2, blue 3, which of them have diabetes mellitus? Yes, only patient number 1. 2 and 3 are not. You don't have to check older values. You only have to look at 2 hours. If it is more than this, 200, it is a direct diagnosis of diabetes, right? Okay. Can you tell me out of 1, 2, 3, 4, which of them is lead time? Advantage gained by a screening test. Which of them is lead time? Take your time, but mark correctly. Good. 3. So with screening, how early you can detect? Without screening, when will final diagnosis occur? This is lead time. What is number 1? What is number 1 known as? Very good. Dr. Muhammad Asif is right. Screening time. Right? So without screening, with screening, when we are going to detect? Which cancer has highest survival after screening? Which cancer has highest survival after screening? Cervical? No. ये तो पुराना क्वेश्चन आपके एफएमजी का. Colorectal, colonic cancer. So colonic cancer has highest survival after screening. 95% plus survival, right? Can you tell me formula of sensitivity? Two formulae are going to come in your FMG paper this time. Sensitivity, specificity. Sensitivity, A upon A plus C, or I can say true positive upon true positive plus false negative. What is specificity? D upon B plus D. True negative upon true negative plus false positive. Can you calculate sensitivity and specificity in this table? A, B, C, D. How much is sensitivity in this? 80%. Dr. Siddharth is right. A upon A plus C into 100, 80 upon 100. How much is specificity? D upon B plus D, 60 upon 100, 60%. Please go through these two formulae. PPV, NPVs are also easy, but go through sensitivity, specificity definitely, right? Now we come to the difficult question of your exam. I know you have memorized the answer, but when we look at disease present, absent, screening test positive, negative, we look at A, B, C, D. Let us read the question. क्योंकि जरूरी नहीं है आपको सेम वैल्यूज आए, दे कैन चेंज द क्वेश्चन ऑल्सो, डोंट से कि आई विल मार्क डी ओनली एज द आंसर. टोटल आर 200 diagnosed positive. So 200 are diagnosed positive out of 2000. So 1800 are healthy. Now total 260 are positive, out of which only 130 had the disease. Who is positive in this test is A and B. True positive, false positive. So total 260 positive, out of which 130 had the disease. This is given to you. Other numbers now you can calculate. So this must be 130, this must be 70, this must be 1670. Now they are asking specificity. D upon B plus D into 100, 93%. Now what is the most difficult thing about this question? When this question came in your paper, you won't be having rough sheet in front of you. So you will have to think in your mind about the table. You will have to place all the four values in your mind in the table, right? And then you do online calculator used to calculate. Impossible nahi hai, because many students claimed they were able to attempt it correctly. Or we can pray to God, same question is repeated exactly. Everyone remembers the answer, 92.77%. One more thing, suppose they ask you, what is the positive predictive value of this test? So you have to read the question. Last time they asked specificity, this time they ask PPV. A upon A plus B, 130 upon 260, 50%. We don't even need calculator. So 130 out of 260, A upon A plus B into 100. So positive predictive value, right? Okay. This is CBNet. Older name of CBNet test, Gene Expert Test. What are the two uses of Gene Expert Test or CBNet test? It can diagnose tuberculosis. It can diagnose rifampicin resistance. Good. Don't look at distractions till your exam. If you feel any of your friend is trying to distract you, do not talk to that friend till the evening of the FMG exam. So complete the FMG exam, तब अपनी दोस्ती निभा लेना, लेकिन अभी उसे भूल जाओ, right? But daily talk to your family, पेरेंट्स, ब्रदर, सिस्टर, राइट? एंड इफ यू हैव बॉयफ्रेंड गर्लफ्रेंड, उससे भी बात कर लेना, कोई प्रॉब्लम नहीं है, राइट? सो स्ट्राइव योर डिस्ट्रैक्शन, फीड योर फोकस, दैट शुड बी डन. वी कम टू कम्युनिकेबल नॉन कम्युनिकेबल डिजीजेस. माइंड अपना रिलैक्स रखना है, राइट? सो डोंट वॉच एनी मूवी और वेब सीरीज, राइट? न्यूज भी मत देखो. What is the incubation period for COVID-19? Let us see how many of you know all the 8 incubation periods which is written on the screen. So COVID-19 is 1 to 14 days, average 5 to 6 days, single value 5.1 days, depending on the choices. Influenza 1 to 3 days, 18 to 72 hours. Diphtheria 2 to 6 days. Which other disease 2 to 6 days is the incubation period also? Yellow fever. What is the quarantine period of yellow fever? Maximum incubation period 6 days. Cholera 1 to 2 days. Yellow fever incubation period is 6 days. We have discussed. Hepatitis A and B. Hepatitis A and B, very frequently asked in FMG. Yes, 15 to 45 days. If they give you choices in weeks, 2 to 6 weeks. Hepatitis B, 45 to 180 days. 6 weeks to 6 months. Measles, 100% will come in your paper. This is 10 to 14 days. What is the single answer? 10, 12, 14 or 16? Single answer if I have to mark. 10 days. Fever appears on 10th day, rash on 14th. Incubation period is appearance of first sign or symptom. HIV around 10 years. Otherwise, it ranges from months till years, right? Okay. Possibacillary leprosy, multibacillary leprosy. How will I clinically differentiate? Anyone? पॉसिबेसलरी, मल्टीबेसलरी। मैंने क्वेश्चन पेपर सेट नहीं करा डॉक्टर वैशाली, मैंने सेट करा होता तो मैं आपको अभी लाइन बाय लाइन सारे 34 क्वेश्चन जो इस बार आ रहे हैं आपको बता रहा होता। राइट, यस। पॉसिबेसलरीज up to 5 skin lesions. Multibacillary, more than 5 skin lesions. What about nerve involvement? Nerve involvement. Yes, 0 here, minimum 1 here. We are talking of nerve involvement. How many drugs are used in treatment of POSI multi? 3 in both. What is the duration of treatment in POSI multi? 6 months, 12 months. What is the duration of follow-up? Anyone? Yes, Dr. Prakhar is right. 2 years and 5 years. Dr. Abdul is also right. MDR TB is resistance to two most important drugs, H and R. What is X in XDR TB? What is X in XDR TB? Extensively. It is not extensive. वो भी choice में होगा. Extensively. Drug resistant tuberculosis. It includes MDR TB, HNR, plus any one fluoroquinolone, plus any one second line injectable out of kanamycin, amikacin, capromycin. Recently, they have included bedaquiline and linezolid as well. In BPAM regimen, we have bedaquiline, linezolid. Which two other drugs are here also included? Pretomanid, okay, and so they are used for MDR, XDR, moxifloxacin, right? So it has been formally introduced in the National TB Elimination Program of the country. Which is this marked correctly? Chickenpox, smallpox. Are they labeled correctly? No. So interchange. How did you identify chickenpox? Why this is chickenpox? It has got three features. 1, 2, 3. Yes, centripetal distribution. What is the second feature? Pleomorphism. What is the meaning of pleomorphism? Anyone? Last FMG it came. It will be repeated in your this paper also. What is pleomorphism? Different stages of rash seen on same person's body at the same time. Please do not be in a hurry. It's not different stages of rash. Rash की तो different stages होती हैं. Different stages of rash, same person body at the same time. And what is the third appearance? This one. Yes, dew drops. So dew drops on a rose petal appearance. So morning of FMG exam, you will have dew drops on your forehead. So that is dew drops on a rose petal appearance, which is characteristic of chicken pox. Right? Okay. रीट वो कब है? नीट यूजी का री एग्जाम कब है? व्हेन डू वी हैव नीट यूजी री एग्जाम? आज ही है, आज ही है. Right? So they already had their dew drops. You will be having them next week. Right? Okay. Bluish white spots on buccal mucosa. We are talking of Koplik spots, measles. What is the characteristic origin of rash? What is the characteristic origin of rash? In measles, you know this is Koplik spots. But where will rash start? It has got retroauricular origin. Yes, retroauricular origin. Why Koplik spot is not seen in clinical practice? Why Koplik spot is not seen? Yes, it disappear 2 days prior to rash, before rash. Most common complication. Serous otitis media. Most common cause of death. Tell me the wrong answer. So pneumonia is a wrong answer. Now tell me the correct answer. Secondary bacterial infection. If secondary bacterial infection is not in the choice, then you mark the second best answer, pneumonia. Late complication. Subacute sclerosing panencephalitis. If I tell you subacute combined degeneration of spinal cord, subacute combined degeneration of spinal cord, B12 deficiency. If I tell you aseptic meningitis as a complication, aseptic meningitis, very good. That is mumps. Now, why this is mumps? Anyone? By looking at the image, why this is mumps? Causative organism, myxovirus parootitis, parootitis, parotid gland. Salivary glands are the most common body part affected. Vaccine strain for mumps. Anyone? Good. Gerillin. Why not Edmonston Zagreb is the answer. Because Edmonston Zagreb strain is for measles vaccine. One of you wrongly mentioned Oka strain. Why Oka strain is not correct here? OKA. Oka strain. Oka strain is for varicella. No, not rubella. Now you tell me what is the rubella's vaccine strain. इसके हम गलती नहीं कर सकते. Matching question will come this time. It is rubella is RA27/3. काफी चीजें मिक्स कर रहे हैं हम. When I'm asking strains, majority of you are answering correct, but around 20% are answering wrongly. 17D रुबेला का नहीं है. 17D is for yellow fever, right? Strains में गलती allowed ही नहीं है because this is a direct question. Identify the three manifestations of congenital rubella syndrome. We have patent ductus arteriosus, heart defect, cataract, and deafness, sensory neural hearing loss. When congenital rubella syndrome is transmitted most commonly? First trimester, second, third, or delivery or after delivery? First trimester. Can you tell me which diseases are most commonly transmitted during delivery? Four H. HIV, hepatitis B, hepatitis C, and herpes. 4H are most common transmitted during delivery. What is the first priority group for rubella vaccination to prevent congenital rubella syndrome? Can I say pregnant females? We should immunize pregnant females. No. Rubella is a live vaccine contraindicated in pregnancy. So you have to immunize before pregnancy. So which is that group? They ask the group. That is non-pregnant, non-lactating, reproductive age group females. Is rubella vaccine a part of national immunization schedule? Is rubella vaccine a part of national immunization schedule? When do we give it? Many are saying no, many are saying yes. Answer is yes. When do we give it? MR vaccines, measles rubella combination, is given at 9 months, but your answer is wrong because it is also given second dose 16 to 24 months. Exam read all the choices. It's not just one dose, two doses of MR we are giving, right? Okay. Identify the disease, the stain used, and the characteristic appearance shown. Disease is diphtheria, Corynebacterium diphtheriae. Stain we use green colored bacilli. Albert. And what is this appearance? Chinese letter. Cuneiform arrangement of bacilli. L form, V form, X form. What is the immunity status test of this disease? Immunity status test. Anyone? Schick test. What is the reading of Schick test taken at? Difficult question because it's an older question. Schick test reading कब लेते हैं? Okay, very good. 96 hours. Can you tell me what is this? metachromatic granules, Babe Ernst granules, volutin granules, polymetaphosphate granules. All four are same. No, not A. All four are same, bhai. So metachromatic, polymetaphosphate, वॉलिटिन ग्रेन्यूल्स, बेबंस ग्रेन्यूल्स, चारों सेम, एग्जाम में कंफ्यूज नहीं होने, राइट. एंड हु ट्रांसमिट्स इन्फेक्शंस मोर इन डिप्थीरिया, केसेस और कैरियर्स? इट इज कैरियर. कैन यू टेल मी which is the other disease where carriers are dangerous more than cases? All diseases spread through cases, but carriers in diphtheria and carriers in meningococcal meningitis. Very right. Disease, strain, appearance. Disease is tuberculosis, Mycobacterium tuberculosis, Zeal-Nielsen stain. Appearance is red colored acid fast bacilli, mostly single having beaded appearance due to presence of mycolic acid pockets. Beaded appearance, acid pocket. Montu test, antigen, dose, strain. Antigen is purified protein derivative, 1 tuberculin unit in 0.1 ml. All the hypersensitivity testing, all the immunity status testing is given on flexor aspect of forearm. Strain. What is the strain of PPD, anyone? Yes, Dr. Ashekar is right. It is RT23 with twin 80. रीडिंग किस चीज की लेते हैं, मेजर क्या करते हैं? इज इट रेडनेस, इंड्यूरेशन, एनी ऑफ द अबव, नन ऑफ द अबव? हॉरिजॉन्टल मैक्सिमम डायमीटर ऑफ. ओके, दिस इज सरप्राइजिंग. हाफ ऑफ यू आर सेइंग रेडनेस, हाफ ऑफ यू आर सेइंग इंड्यूरेशन, इसलिए तो क्वेश्चन पूछा था. इट इज इंड्यूरेशन. देखो, रेडनेस मेजर करने से क्या मिलेगा? हो सकता है उस वक्त आप ब्लश कर रहे हो एग्जाम के बारे में सोच के. सो इट इज इंड्यूरेशन, हॉरिजॉन्टल मैक्सिमम डायमीटर. Which type of hypersensitivity reaction this is, and when do we take the reading? Hypersensitivity reaction is 4, and when do we take the reading? After 72 hours. 9 millimeter positive if it is more than 9. Ever infected less than 6 negative. 6 to 9 equivocal, repeat after 3 months. Disease. How did you identify that this is mucormycosis or black fungus? It has a characteristic antlers on moose appearance. If you look at the hyphae, they are branching at 90 degree, aseptate, ribbon-like. Drug of choice. Liposomal amphotericin B is also the drug of choice for one more disease in another program of India. म्यूकरमाइकोसिस के अलावा ये ड्रग ऑफ चॉइस है काला आजार की. वेरी गुड डॉक्टर सिद्धार्थ. सीटी विल शो म्यूकोजल थिकनिंग एंड बोनी इरोजन. एमआरआई विल शो नेजल टर्बिनेट साइन. हो सकता है एग्जाम जब आप ओपन करो आपको पहला क्वेश्चन ना आता हो. ये काफी बार होता है स्टूडेंट्स के साथ, या किसी स्लॉट में पहला क्वेश्चन ना आता हो. नथिंग टू वरी. दूसरा नहीं आता, नथिंग टू वरी. तीसरा नहीं आता, नथिंग टू वरी. आपके वैसे भी 300 में से 300 नहीं आने. सो देर विल बी अराउंड 15 to total 20 questions in the paper which you will be hearing for the first time. आपको कई बार सब्जेक्ट का भी पता नहीं चलेगा, राइट? तो यू डोंट वरी अबाउट दोज 20 questions. Focus on the other 280 questions, out of which many of you are going to score above 220 this time. सो पेपर थोड़ा सा इजी होगा इस बार, लेंदी होगा, लेकिन पढ़ना कंटिन्यूअसली. कीप ऑन स्टडिंग, कीप ऑन रीडिंग द क्वेश्चंस. क्वेश्चन देख के मत डरना कितने लंबे लंबे क्वेश्चंस है तो मुझे नहीं आते, राइट? ओके, यस. 100 to 140 क्वेश्चंस विल बी डायरेक्टली वन लाइनर, वेरी वेरी इजी. मतलब 140 तो आपके वैसे ही आ जाएंगे बिना कुछ करे, ये आपको ध्यान रखना है. सो जस्ट अनदर 60-70 क्वेश्चंस विल टेक यू अबव 200. याद रखना एग्जाम में. कैन यू टेल मी द सीक्वेंस ऑफ एंटीजेंस अपीयरिंग इन hepatitis B. Serum markers. What is the appearance of antigen sequence? फर्स्ट अटेम्प्ट तो बेस्ट होती है, मैक्सिमम रिजल्ट उसी में से आता है. यस, सरफेस कोर एनवेलप. एन एंटीबॉडी, कैन आई से सेम सरफेस कोर एनवेलप? नो, कोर एनवेलप सरफेस. एपिडेमियोलॉजिकल मार्कर कौन सा है इसमें से? सरफेस एंटीजन, ऑल्सो नोन एज ऑस्ट्रेलिया एंटीजन. मार्कर ऑफ इन्फेक्टिविटी, marker of infectivity is hepatitis B envelope antigen. Marker of good prognosis, if its antibody appears, anti-HBE. So what is the marker of acute hepatitis? Very popular question of your exam. What is the marker of acute hepatitis? It is IgM anti-HBC. IgG chronic का बन जाएगा. End of communicability and vaccinated. Both these groups show antibody to surface. What is serum hepatitis? कई बार क्वेश्चन इतना भी आसान आ जाता है. Serum hepatitis. Okay, first question where no one is answering today. How it is possible, friends? What is serum hepatitis? Serum hepatitis is hepatitis B. Hepatitis A is known as infectious hepatitis, which has highest mortality in pregnancy. Which has highest mortality in pregnancy is E. Dr. Abhishek is right. Waterborne कौन सा है? A and E. B, C, D are through sexual route. Can you tell me these four values? When we look at WHO, low osmolarity ORS, then just tell me four minimum values you have to know. Yes, sodium is 75 millimoles per liter. Potassium is 20. 65, 10, 75. Total of 245. When you dissolve 1 liter water, 1 ORS packet, 245 millimoles liter. But can you tell me, when you look at weight was also asked in your paper. How much is sodium chloride? How much is potassium chloride? 2.6, 1.5, 2.9, 13.5. Developed by Dr. Dilip Mahalanobis, right? So, low osmolarity ORS, also known as medical discovery of last century. Medical discovery of last century. FMG question. Botulinum toxin, most common mode of transmission. Is, yes, वैसे डायरेक्टली देख लेते हैं इसमें, क्योंकि डायरेक्टली चॉइस दिया हुआ था आपके एग्जाम में. कैंड फूड, कैंड फूड. Just remember one thing in this: droplet infection is direct transmission. Droplet nuclei is indirect transmission. Although it is for PG exams, but still you should know droplet is direct, droplet nuclei is indirect, airborne transmission. Okay, ये तो बता देंगे हम easily. If you see carefully, these are step wells. We discussed the concept a person can go down in the water, skin comes in contact, lesion ruptures, which cycle is completed. That is guinea worm. Guinea worm is a which type of disease? Waterborne, water based, water insect related, water washed. Yes, it is water based disease. Some organism resident of water plays a role in transmission cycle like cyclops here. Can you tell me its status in India? Guinea worm status in India. It was eliminated February 2000. Jodhpur 1996 was the last case. Step wells are present in Gujarat, Rajasthan mostly. Identify the disease. Route of transmission. Route तो आपके सामने है. Penetration of skin of foot when a person walks barefoot on soil. This is hookworm. It is associated with which disease? And what is the amount of blood loss in this iron deficiency anemia? 0.03 to 0.2 ml per worm blood loss per day. Average is 0.1. You have to remember this value. Measurement index shown in the table below is known as Chandler. Chandler index is number of eggs per gram of stool, not for individual person but community stool. When is Chandler index a major public health problem? If the value goes above 300. If the value goes above 300. What is the drug of choice for hookworm in India? Albendazole. What is the drug of choice for roundworm in India? Albendazole. National Deworming Day is observed on FMG question. 10th February. And if they ask you and also, after 6 months, 10th August. Best indicator for malaria control. MCQ. API. API also happens to be the most sophisticated measure. Operational efficiency. Annual blood examination rate. Recent transmission. Infant parasite rate. Endemicity. Spleen rate. Anthrophilism. Anyone? What is the best indicator of degree of anthrophilism? इनमें से तो आंसर है ही नहीं जो आपके सामने चॉइसेस में. डॉक्टर एगॉन इज राइट. ह्यूमन ब्लड इंडेक्स. व्हाट इज द मीनिंग ऑफ एंथ्रोफिलिज्म? नाम से पता चल रहा है. एंथ्रो इज ह्यूमन, फिलिज्म इज लव. तो हाउ मच ह्यूमन ब्लड is loved by Anopheles mosquito and National Board of Examination. That is the degree of anthrophilism, human blood index. Can you identify the disease in the image? कौन सी है? सिर्फ आपके एग्जाम के क्वेश्चन डिस्कस कर रहे हैं इन दिस सेशन. प्लीज रिमेंबर यू हैव टू नो ईच एंड एवरीथिंग आई एम सेइंग टुडे. Japanese encephalitis. Who is the actual host? असल में किसकी डिजीज होती है? मैन की नहीं होती. इट इज अ डिजीज ऑफ आर्डाइड बर्ड्स, वाटर बर्ड्स, डक्स, फाउल्स, हिरॉन्स. हु इज द एम्पलीफायर होस्ट? It is pigs. Organism multiplies but do not cause the disease. Man is accidental dead end host. Man is accidental dead end host. And who is the vector? Which culex? नाम बता दो स्पीशीज का. मॉस्किटो कहने से कैसे काम चलेगा? एडिस इजिप्टाई कैसे हो सकता है भाई? क्यूलेक्स लिखा हुआ है सामने देखो. क्यूलेक्स ट्राइटिनियोरिंकस. व्हाट इज द वेक्टर ऑफ लिम्फेटिक फाइलियरियासिस? Which culex? Culex fatigans or Quincke fasciatus. What is the vector of West Nile fever? Culex pipiens. These three you have to do. One of them will come in the paper, right? Okay. Diagnose the disease by looking at the geographical distribution. This is, yes, political madness, Kala-Azar. So we have phlebotomous sandfly as the major vector of Kala-Azar in the country, right? Okay. A person is shifted from Nigeria to USA. When he was traveling from Nigeria to USA, which of the following certificate he needs to carry? कौन सा? Yellow fever. वैसे answer is none of the above. Nowadays they go through boats, right? So yellow fever vaccination certificate is required for international travel to many parts of USA. And what is the validity of this vaccination certificate? Anyone, friends? Validity कितना होती है? Dr. Shinchan is right. 10 days to lifelong. Good. Can you tell me the strain that we have already discussed of yellow fever vaccine? 17D. Others I am skipping because we have already discussed. This is live attenuated vaccine. Diagnose the disease by looking at the image. Then I will ask you a lot of questions. This is trachoma. Its field diagnosis require 2 out of 4 conditions. What are these 4? Number 1 is this. Large follicles on upper tarsal conjunctiva. Number 2 is these. What are these? Limbal follicles, also known as Herbert pits. Then we have scarring and pannus. Any 2 out of these 4. What is the drug of choice? What is the status in India? Drug of choice is 20 milligram per kg, single dose azithromycin. And what is its status in India? When was it eliminated? Anyone? Yes, 8th October 2024. Can you tell me what is safe strategy used for? Surgery, antibiotic, facial, cleanliness, environmental. Which disease? Okay, trachoma. What is the surgery recommended for? Only 2 conditions. Which are these? Entropion. And what is the other condition for which it is allowed to do surgery under this? Trichiasis. Now, if suppose they give you a long clinical question, a person gets injury while walking on the road, he falls down. Then through history you came to know he took tetanus toxoid 3 years ago. He is having deep penetrating wound more than 6 hours ago. What should be done? What should be done? I'll repeat. He has deep penetrating dirty wound more than 6 hours. He took tetanus toxoid 3 years ago. Yes, nothing will be done, friends. Many of you are giving wrong answer when you know tetanus toxoid is asked in every alternate exam of FMG. You cannot do this wrong. Nothing is required if someone has taken tetanus toxoid booster or complete course in last 5 years. One dose is required if that is 5 to 10 years. If that is 5 to 10 years, right? Okay. So just read this table properly and then we should not do. See, few things are definitely coming in your exam. We know rabies vaccine, cervical cancer vaccine, tetanus toxoid based on this table. So these things you have to revise before the exam. Okay. Read the question. Which disease are we talking of? Which disease are we talking of? आंसर तो सबने PYQ से याद करा हुआ है. ट्रेकोमा, हाइपरथर्मिया. जब मैंने इजी क्वेश्चन पूछा तो सबने गलती कर दी. Now answer. Now answer. Yes. So first we are looking at prevention of neonatal tetanus. After that, we are looking at close skin to skin contact. Then you can say neonatal hypothermia. So which of them is not done as per the guidelines? clean blades, cutting cord, baby's eyes cleaned with sterile cotton cloth, bathing with clean water, close skin contact, exclusive breastfeeding. Not done is bathing. Now, just to tell you what are 5 cleans of safe delivery, which is used to prevent maternal, especially neonatal tetanus. 5 cleans. Anyone who is confident he or she knows all the 5 correctly? क्लीन हैंड्स, मदर और न्यूबॉर्न किसके हाथों की बात हो रही है? नाइदर मदर नॉर न्यूबॉर्न, इट इज द पर्सन हु इज कंडक्टिंग द डिलीवरी. एग्जाम यू हैव टू रीड द चॉइसेस. मदर या न्यूबॉर्न के हाथ क्लीन करने से नियोनेटल टेटनस कैसे बचेगा? पर्सन हु इज कंडक्टिंग द डिलीवरी, डॉक्टर और द हेल्थ वर्कर. क्लीन सरफेस. So can I write it as clean cord surface? Can I say clean cord surface? No. फिर ये कौन सा सरफेस है? दिस इज डिलीवरी टेबल सरफेस. मदर का सरफेस नहीं है, डिलीवरी टेबल सरफेस है. डिलीवरी टेबल सरफेस. देन क्लीन कॉर्ड कट, दैट इज थ्रू सीजर और ब्लेड. क्लीन कॉर्ड टाई, that is to sterile rubber band. Nowadays we have clips also. And clean cord stump. No applicant should be allowed. Recently this has been expanded to become 7 cleans. So 2 more cleans were added. Clean water. Who will drink this water? Who will drink this water? No one. This is for mom. Mom को पानी पिला के क्या करोगे भाई? टेटनस कैसे रुकेगा? No one. This is for washing the hands of the doctor or the surgeon or the nurse who is conducting the delivery. एग्जाम में ब्रेन का यूज बहुत करना है, पूरा करना है, राइट? वी आर टॉकिंग ऑफ डिजीज नियोनेटल टेटनस. क्लीन्स उसी लिए होते हैं ना. टॉवल. व्हाट विल यू डू विथ टॉवल? अब तो ये भी पूछना पड़ेगा मुझे. व्हाट विल यू डू विथ टॉवल? क्लीनिंग द बेबी. बेबी को क्यों क्लीन करोगे भाई? बेबी को क्यों क्लीन करोगे? कभी देखा है न्यूबॉर्न बेबी को क्लीन करते हैं? आप हो डॉक्टर, आपकी क्लीनिंग की ज्यादा जरूरत है. यस. रैपिंग द बेबी. बेबी को रैप करके टेटनस कैसे रुकेगा? भाई आज तो सबने दिमाग बिल्कुल बंद करके बैठे हुए हैं सेशन में. इट इज नॉट फॉर रैपिंग द बेबी, इट इज फॉर मॉपिंग द वेट हैंड्स ऑफ द पर्सन हु इज कंडक्टिंग द डिलीवरी. ध्यान से सोचना है. वी आर टॉकिंग ऑफ प्रिवेंशन ऑफ नियोनेटल टेटनस. सो क्लीन वाटर is for washing the hands. Clean towel is for mopping the hands of the person who has conducted the or conducting the delivery. You can say these are extension of clean hands. तो आप ऐसे भी कह सकते हो. So 5 cleans plus 2 cleans, 7 cleans of safe delivery under RCH program of India. This is just to tell you, in the exam, don't look at the first 2 choices, mother, newborn, and move forward after marking the answer. Even if you know the answer, read choice C and D also. C and D also. Quickly देख लो. अगर choice पता है तो भी फटाफट देख लो. Right? Okay. Question 27. Lepra reaction in multi-drug therapy. Lepra reaction. Yes. Why do you continue MDT? Because lepra reactions are routinely seen when treatment is started. So we don't stop MDT. Rather, we treat lepra reactions separately. Now, lepra reactions are of 2 types. Just remember, type 1 is reversal reaction. Type 2, erythema nodosum leprosum. Remember, type 1 lepra reaction. Type 2, erythema nodosum leprosum. Erythema nodosum leprosum. If you look, don't worry, staff, the backend team staff will manage. Drug of choice, simultaneously treat them with steroids. Whether it is type 1, type 2, generally steroid is the drug of choice. Drug of choice. Are they arranged in correct sequence? STD color coded kits on the screen. Do you feel are they arranged in correct sequence? Think of mnemonic in the mind. Tell me which two are wrong. Tell me which two are wrong out of these seven. Which are wrong? Yellow and red. सही है ये. Nothing is wrong on this slide. Everything is correct. If you look at gray kit, this is used for cervical discharge, urethral discharge, and scrotal swelling in males. Kit number 2, vaginal discharge. Frothy, that means trichomonas. What about kit number 3, 4, 5? Anyone, friends? What is 3, 4, and 5 common to that? All three are used for genito-ulcerative disease, non-herpetic 3 and 4, herpetic 5. Then what is the difference in 3 and 4? What is the difference in 3 and 4? Anyone? Yes. Fourth one is if it is allergic to penicillin. In your exam, they have repeatedly asked color of kit number 4, blue colored. Kit number 6 and has also been asked, that is lower abdominal pain, PID. 7 is inguinal bubo. And now we have 8th brown, which is for brown kit किसके लिए होती है? Very right. Anorectal discharge. Where will a patient get this color coded kits? Where should we send the person to? Yes, primary health center also, or STD clinic now known as Suraksha clinic. So STD treatment is available at PHC, CHC, Medical College District Hospital and Suraksha clinics. Health programs. Which program is this? Yes, National TB Elimination Program. Target year of elimination 2025 था. Very right. So reduce incidence by 80%, mortality by 90%. Mortality by 90%. Right. इतने सारे न्यूमोनिक मत पढ़ लेना कि न्यूमोनिक याद आ जाए बस एग्जाम में और कुछ सब भूल जाए. ऐसा नहीं होना चाहिए. राइट. ओके. दिस इज वी डिस्कस्ड अर्लियर ऑल्सो. जीन एक्सपर्ट टेस्ट, सीबी नेट टेस्ट. Right. Can you just read the question carefully? It is such a easy question. What should I mark? Surveillance system. Nikshay. Why not dots 99? Anyone? Yes, good. It is adherence system. Why not Nishay? निश्चय क्या होता है? प्रेगनेंसी टेस्टिंग किट, यूपीटी, यूरिन बेस्ड होम बेस्ड प्रेगनेंसी टेस्टिंग किट. So if you look at dots 99, toll free number, missed call has to be given after consuming the medication. This is adherence system. But all the dots clinics in the country are joined by a software known as Nikshay. This is a surveillance system. If surveillance word is missing in the choices, monitoring is also correct. What is Anmol? ANM online. So auxiliary nurse midwife, she is having this software which is tablet based. So she is having a tablet in which this software is installed for filling up all the data of RCH program, reproductive child health program of the country. We are only discussing your FMG exam questions. Please remember. WHO definition of blindness. NPCBVI India definition of blindness. Both are now same. Less than 3/60. Now, when we look at blindness control program of India, what is the commonest cause? of blindness, low vision, and visual impairment. All three answer is same, and that is cataract. But ocular morbidity, anyone? Good. Refractive errors which are uncorrected till now. Prevalence of blindness is 0.36%, visual impairment 2.55%. Whenever we say less than 3 by 60, it is in better eye, best possible correction. Now, when we look at LESMA, it is an abbreviation of low vision, economic blindness, social blindness, manifest, absolute. In this, economic blindness is work vision, social blindness is walk vision. How many of you remembered all the five categories correctly? By I was writing. Yes, you have to know because it has been asked multiple times. Very good. If they ask you by number this time, these categories have recently been given number, category number 1, 2, 3, 4, 5. Nothing changes. So LESMA is 1, 2, 3, 4, 5. Now, tell me this person will be classified in which of the categories? Right eye less than 3 by 60, left eye less than 6 by 60. Which is the better eye? पहले तो आप ये बताओ which is the better eye of this person? Right or left? Which is better? यार ये कैसे डिफरेंट आंसर आ सकता है? ऑफ द यू हैव स्टडीड विच इज अ बेटर आई भाई. बेटर इज योर लेफ्ट वन. So this is a case of economic blindness less than 6 by 60 to 3 by 60. 3 by 60. Now let me make the question slightly more complicated. Suppose they give you same person. They say when you measure the visual acuity of the person, it comes less than 3 by 60, less than 6 by 60. Now person tells you he already has been given spectacles and he is using that also. Now I ask the person, please wear the spectacles. When he wears the spectacles, his visual acuity improves above both. So he is more than 3 by 60. He is more than 6 by 60. This person will now be a case of low vision. So most likely he is a case of low vision. We look at the better eye which still remains the left eye. Good. So everyone knows the concept. That's wonderful. HIV first case was found in USA. HIV virus discovery 1983. It was Montagnier Synossi of France, Robert Gallo of USA. Year was asked. Most common route of HIV transmission that is least efficient also. What is the answer to this question, friends? Most common, least efficient. Sexual. Paradoxically, which is most dangerous but least common? Blood. Which five diseases we screen in a donated blood unit? Can you tell me which five diseases we screen in a donated blood unit? HIV, HBV, HCV, syphilis, malaria. Which level of prevention this is? When you screen for five diseases in a donated blood unit. This is. Okay, how can we get different answers, friend? ये तो आसान क्वेश्चन पूछा है मैंने. Screening is generally secondary, but here you are screening for someone else's benefit. When you are screening in a donated blood unit, idea is to not give a infected blood unit to a healthy person. This is primary level specific protection. Which type of screening this is? Prescriptive or prospective? Most of these screenings are prescriptive, but this is prospective screening. Carefully read the question. Remind yourself of the concept we have discussed in mission classes, hyper revision, lab 2 also we have discussed, right? Okay. Truck drivers are a part of, in HIV epidemiology, high risk population, bridge population, general population. It is bridge population. So, high risk is those who have high prevalence and are more at risk: sex worker, homosexual, injecting drug users. From them, how infection reaches general population is through their clients. So, clients of sex workers, truck drivers, migrant population, partners of injecting drug users. We have to remember. Which type of testing is done for HIV in National AIDS Control Program of India? Is it opt in, opt out? Which testing is done for HIV? Opt out. What do we do in opt out? You take the blood sample, then you tell the person, now we are going to now you we are going to test for HIV. Can person refuse now? यस, बट अब आप उसका ब्लड सैंपल ले ही चुके हो तो बेचारा क्या ही मना करेगा। जब नेशनल बोर्ड आपसे एफएमजी एग्जाम की फीस ले ही चुका तो अब आप क्या बोलोगे, राइट? सो स्टिल अ पर्सन हैज ऑप्शन ऑफ ऑप्टिंग आउट, बट दिस इज बेटर देन ऑप्ट इन टेस्टिंग। मोस्ट कॉमन अपॉर्चुनिस्टिक इन्फेक्शन कौन सा है? टीबी। अपॉर्चुनिस्टिक का क्या मतलब है? वर्ल्ड में होता है न्यूमोसिस्टिस कैरनाई न्यूमोनिया। Generally, it cannot happen, but there is an opportunity because of low CD4 count, right? So, National Board sees you have to give FMG exam in India, you have no other option. So, they keep the fees by their own choice. They can keep 1,000 rupees also, but they want to take the opportunity. ART initiation is done at what CD4 count level in the country? Any CD4 count. Any CD4 count in the country, right? Okay. Prevention of mother to child transmission of HIV in the country. Can you tell me what is the current regimen of choice? Anyone? Mother to child. Yes, LTE. Lamivudine, tenofovir, efavirenz. If mother has received efavirenz earlier in life, it should be substituted with lopinavir, ritonavir. पोस्ट एक्सपोजर प्रोफिलैक्सिस रेजिमेन क्या होता है इंडिया में? अ हेल्थ वर्कर गेट्स नीडल स्टिक इंजरी, एक बहुत लंबी स्टोरी बनाएंगे। इट इज एलटीडी, लेमिवुडीन, टिनोफोवीर, डोलुटिग्रावीर। व्हेन इट शुड बी स्टार्टेड, हाउ लॉन्ग इट शुड बी गिवन? पोस्ट एक्सपोजर प्रोफिलैक्सिस should be started as soon as possible, maximum within 72 hours, and it should be given for a continuous period of 28 days. Good. All of you are writing correct answer. So whenever you are going correct, I will not mention, we'll move forward. Which vector is shown in the image? Anopheles sitting at 45 degree to the surface of skin. A student said this is female Anopheles. Why? Only female Anopheles bite and transmit the disease, right? Only female suck blood. ऐसा भी नहीं है भाई, right? So please remember two diseases where female vectors transmit the disease. One is malaria. Which is the other one? Besides malaria, which other disease female vector transmit the disease? डेंगू नहीं भाई, एडिस में मेल भी सक करता है ब्लड। एनीवन? गुड डॉक्टर अरसलान, इट इज कालाजार. सो फीमेल सैंडफ्लाई ट्रांसमिट कालाजार, फीमेल एनोफिलिस ट्रांसमिट मलेरिया, एनोफिलिस क्यूलिसिफेसिस रूरल, एनोफिलिस स्टीफेंसाई अर्बन. Read this question. Read this question. I will highlight what you need to study. Manipur, Northeast India. Plasmodium falciparum. What should I mark? B. Why I should not give ACT-SP? Artesunate sulfadoxine pyrimethamine. Because that is for other states of the country. Very right. I will ask you to memorize this. See, all of us know for Vivax, we have chloroquine and primaquine. For falciparum malaria, we have artemisinin-based therapy. So, artesunate combination therapy with sulfadoxine pyrimethamine. 3 drug combination in other parts of India. 2 drug ACTLM, artemether lumefantrine in Northeast. Primaquine is always given except in pregnancy. Here, just remember, primaquine is contraindicated in pregnancy, but sometimes a single low dose is permitted if required. Otherwise, based on the recent question, now examiner wants us to remember this also, right? If it is a mixed infection, you have to treat generally like falciparum. Try to go for ACT, AL, ACT, SP. Generally like, right? Okay. So just have a look at this. B and C, duration of primaquine. Primaquine is given here, right? Duration is the key. This we have already discussed. Histidine rich protein. You tell me the third answer. Histidine rich protein type 2 Plasmodium falciparum antigen, dengue NS1. And third one you have already answered. Reverse kinesin 39 antigen. Because program categorically mentioned artemisinin derivative should never be used alone. It is always used in combination. So artemether alone, artesunate alone cannot be used for treatment at all. This is Meena Mala Sapna Mira. It is Sapna. Older cured case of leprosy, currently used to spread awareness, reduce stigma, discrimination. What are the mascots of Census of India? I think last उसमें हमने डिस्कस भी किया था. I shared on your group also Instagram post. Pragati and Vikas. Pragati and Vikas. Female and male. Right? Okay. This we have discussed, so I will skip. But this you must tell me. Ridley Jopling, possibly bacillary includes TT and BT, multibacillary, BB, BL, LL. Most common in India, borderline tuberculosis. Ridley Jopling is which type of classification? Clinico-bacterial, immunohistological, or operational? Which type of classification this is? Clinico-bacterial, immunohistological, operational. This is a immunohistological classification. Posse and multi is the operational classification. You have to remember, right? Okay. Now, if you want to reduce or prevent coronary heart disease, what is the overall goal? To reduce HDL cholesterol ratio should be less than. Good, less than 3.5. It can be achieved through 6 dietary modification. First 3 are separate questions of FMG. Total fat intake should be less than 30%. Saturated, take it below 7. Salt below 5 grams a day. Beside this, total cholesterol intake should be less than 200 milligram per day. Increase complex carbohydrates and avoid something which FMGs have never heard of. That is alcohol. Avoid of alcohol. 6 dietary recommendations which can prevent or control coronary heart disease. So please remember this is for CST. Coronary heart disease, right? Okay. नहीं कुछ भी नहीं भूले हो डॉक्टर एके. When the question will come in the exam, you will remember. Many times you will remember my voice or you will remember your own voice. जब आपने उसे पढ़ा होगा या आपको नोट्स में वो नजर आएगा या स्लाइड या पीडीएफ में भी जो आपने देखा उसे नजर आएगा. What is alcohol? Yes, यही मैं आपको बता रहा था कि you have never heard of it. Just leave it. It's something which is not so useful. It's okay. Identify what is shown in the image and which disease are we talking of. Rule of half. This is Which disease? Hypertension. So, can you tell me? I have marked five things. What are these in succession? Outer circle, total population. Out of them, 50% have hypertension. Out of them, 50% are symptomatic. Out of them, 50% seek treatment. Out of them, 50% get adequate treatment. So once they asked innermost black circle, adequate treatment. Now, one thing I will tell you, suppose they give you total population 10,000. They tell you hypertension prevalence is 20%. Can you now tell me how many people will have hypertension? 2,000. How many will be symptomatic? 1,000. How many will seek treatment? 500. How many will get adequate treatment? 250. So please remember, generally 50% rule is there, but sometimes in your paper, examiner is very smart. He changes this value. This you have to be careful. If nothing is mentioned, then you can go 10,000, 5,000, 2,500, 1,250, 625. That you can do. But if they change the prevalence, you will have to use that prevalence in the calculation. Everyone has understood this concept now? Nothing is mentioned, 50-50%. But if some prevalence is given, that you have to take care and then go 50-50%. Right? Okay. Practice the PYQ that you must have seen 7.5%, 3.75%. Right? Okay. This is again same disease, rule of tracking phenomena. Very right. So this is tracking phenomena. So if you were taking lesser alcohol in FMG, you will remain on the lesser side. But if you were on the higher side, you will remain on the higher side. So BP follows track of an athlete. Track of an athlete. Hypotensive in childhood remains hypotensive in adulthood. Hypertensive remains hypertensive on adulthood. ब्रेक कब मिलेगा? ब्रेक आपको मिलेगा एफएमजी एग्जाम खत्म होने के बाद. सेंटिनल सर्विलेंस इन आईडीएसपी प्रोग्राम ऑफ इंडिया इज कवर्ड और इज कवरिंग 5 पैरामीटर्स. एनीवन हु इज श्योर रिमेंबर्स ऑल दी 5. पांचों किसको याद है? ओके, सो लेट्स गो फॉर इट. HIV, hepatitis B, hepatitis C, and there are two parameters which are not diseases. Very right, doctor, you are right. It is air quality, water quality. See, look logically, regular surveillance is done for common diseases, waterborne, mosquito-borne, respiratory. Periodic surveillance is done for non-communicable disease risk factor and related anthropometry. Which form is filled up by doctors? S form, P form, L form. As a medical officer, you as a doctor will fill P form, presumptive diagnosis. S form, syndromic diagnosis is done by health workers. L form, lab confirmed diagnosis by laboratory staff. Look at the image under Ayushman Bharat, new name of sub center. Image की जरूरत नहीं है. They can directly also ask you. Ayushman Arogya Mandir. Its older name. What was its older name? आयुष्मान आरोग्य मंदिर का पुराना नाम. It is written Health and Wellness Center, which is the other component of आयुष्मान भारत प्रोग्राम. एक तो आपका ये हो गया हेल्थ एंड वेलनेस सेंटर नाउ नोन एज आयुष्मान आरोग्य मंदिर. व्हाट इज द अदर कंपोनेंट? एनीवन? Name of the program. Listen to the question. No, not even a single student has answered correctly till now. This is surprising. Dr. Sumant is right. Pradhan Mantri Jan Arogya Yojana. So there are two components of Ayushman Bharat. One is this Health and Wellness Center, now known as Ayushman Arogya Mandir. Second is Pradhan Mantri Jan Arogya Yojana. फिर वो क्वेश्चन आएंगे जो मैंने पूछे नहीं और आपने आंसर कर दिए. तो एग्जाम यू हैव टू रीड द क्वेश्चन केयरफुली. It is rupees 5 lakh per family per year below poverty line, secondary, tertiary level of hospitalization. Ayushman Bharat program is associated also with school health. School health, right? Okay. This one. So we have discussed, we'll move forward. 5 lakhs per family per year. Empanelment is minimum 10 beds. In some states, they are trying to make it 50 beds as the minimum requirement right now, but 10, right? What is the strategy covered under this program? क्या है? 6 by 6 by 6. It includes 3 components. Anyone, what are these? These are 6 beneficiaries, 6 interventions, 6 institutional mechanisms. It does not include 6 ministries. 6 ministries. Okay, can you tell me, Anemia Mukt Bharat, how much we want to reduce anemia every year? How much prevalence we want to reduce every year? 3%. Good. Okay, read this question. Pregnant female getting iron folic acid, Anemia Mukt Bharat. You want to improve the efficacy of therapy. What will you give to her? Albendazole. Why? रीजन पूछ सकते हैं आपसे इस बार. Why will you give albendazole? सेकेंड ट्राइमेस्टर में ही दे सकते हैं. डीवर्म करने से क्या फायदा होगा? It will improve nutrient absorption, plus if it is hookworm, it will also reduce blood loss, right? Okay, which vitamin, which you are saying, which vitamin is useful to improve this absorption? Which vitamin is used for IFA absorption? That is iron folic acid. Iron absorption is increased by vitamin C. Only facilitator of iron absorption. Anyone who can tell me all the 6 values? किसको कॉन्फिडेंस है कि 6 की 6 वैल्यूज बिल्कुल करेक्टली पता है? Because this is minimum which is required from you in the paper. Okay, let's go for it. 20 and 100, 45 and 400, then 60 and 500. Have a look at the color of the tablet. Is something wrong in the table? Color of the tablet is something wrong. They are saying children are pink, adolescents are blue, others are red. This is correct. Can you tell me, if I look at adolescent in WIF's program, only one thing beyond this program I am asking you to remember, how much iron and folic acid is given to adolescent girls in weekly iron folic acid supplementation? Dr. Sumant is right, 100 and 500. So again, I'll repeat, you have to remember only this. But if they ask you WIF's adolescents, then it is not 6500, it is 100 and 500. Please remember. Good. If female is moderate or severely anemic, what will you give to that female under Anemia Mukt Bharat? Yes, we give IV form of iron. 2 forms are allowed. Which are those 2 forms? One is IV sucrose. and one is ferric carboxymaltose. FCM is ferric carboxymaltose. Good. Read carefully. You just have to read this question carefully. D. We give generally 180 days of pregnancy last 6 months and next 180 days of lactation. What is ninth? बीडी। भाई इसमें बीडी कहीं पे भी नहीं है। बीडी जब देते हैं आपका अगर मॉडरेट एनीमिया हो एंड यू कैन इंक्रीज अप टिल बीडी, बट इफ इट इज नॉट रिस्पॉन्डिंग देन यू शिफ्ट टू आईवी फॉर्म ऑल्सो। यस, दिस इज फ्री antenatal checkup by a private practitioner on ninth date of every month. It should be in second or third trimester, and all investigations plus USG must already have been completed. Pradhan Mantri Matru Vandana Yojana. Woman gets 2000 rupees if there is registration of pregnancy plus one antenatal visit. When will she get 3000 now? If birth registration of the newborn along with four important vaccines given: BCG, DPT, OPV, hepatitis B. Now, under this scheme, for second childbirth, only for girls, she will get directly 6000 on completion of all the four. If it is a twin girls in second delivery, 12,000. If it is a boy in second delivery, so boys are useless, 0. If it is a third delivery, then boys and girls both are useless, nothing should be given, right? Okay. Your exam day will be a new dawn for you. So on that day, just stay focused. Don't lose focus till the last minute of the exam, right? So this you have to be very, very careful, right? Okay. आगे चलते हैं. Now we look at demography and health. Demography. PMMV wise 2000 and 3000 for first childbirth, but 6000 in second childbirth provided it is only girl. If it is twins, 6000 plus 6000, 12,000 can be given. WIFS is weekly iron folic acid supplementation. What is B? Yes, B is death rate. A is birth rate. What about C? Total population. What about India is in which stage? India is in which stage? Stage 3. What is the name of stage 3? Where India is late expanding. Any country which has reached stage 4 or even 5. Many European countries, right? Okay. Literacy rate is number of literates. What is the denominator was asked in FMG? What is the denominator? Anyone? Yes, Dr. Mohammad Asif is right. Total population is 7 years and above into 100. 74% in the country, highest Kerala, lowest Bihar. Who is a literate by definition? A person who is able to read, write, understand any one language of the country, right? Growth rate of India, what is the value? Anyone remembers the value? Yes, Dr. Krishna is right, 1.64%. In sex ratio and child sex ratio, numerator is male or female? Numerator is females. So here, female children 0 to 6 year, male children 0 to 6 year, both have 1000 as the multiplier. Value of sex ratio 943, 919. Sex ratio highest Kerala, lowest Daman and Diu. Child sex ratio Mizoram, Haryana. Big divide in census of India 1921. Data collection. Which type method is used in India? De facto, de jure, any of the above, none of the above. What is de facto? Yes, wherever you are found on that day, you will be counted on that day. So if you are found in London like Virat Kohli, you will be not counted in the census of India. So de facto, आप जहां पर हो वहीं के काउंट होगे. De jure, you will be counted as your original place. तो de jure करते तो विराट कोहली रजौरी गार्डन दिल्ली हम काउंट करते, राइट? सो de facto wherever you are located on the day of enumeration, right? Okay. Why sample registration system is most accurate? Anyone? Yes, twice. Dual record data collection. Which of them is not measured in SRS? IMR, MMR, under 5, neonatal, perinatal growth rate. All are measured, but MMR has a separate reporting, separate report. Birth should be registered within, death should be registered within 21 days. Birth registration is the responsibility of डॉक्टर, हॉस्पिटल, पेरेंट्स, डोनाल्ड ट्रंप. किसकी रिस्पॉन्सिबिलिटी है बर्थ रजिस्ट्रेशन? इट इज हॉस्पिटल, इंस्टीट्यूशन, or you can say primary health center, wherever the delivery takes place. Child born to NRI couple abroad, birth registration must be done within 60 days of arrival in the country. Correct. Total fertility rate. See, we are going faster because in mission classes we have already covered whole course in 45 hours. Then in lab 2, again live classes, we covered the course in around 13 hours. Now 5 hours we have to cover. Yes, total number of children born to a couple. Gross reproduction rate is girl children. Even net reproduction rate is same. Then how is net reproduction rate different from GRR? Dr. Abdul is right. It is minus their mortality. Mortality is taken into account. Net, you can say living girl children. Completed family size is total fertility rate. And crude birth rate is 8 times TFR plus 1. 8 times TFR plus 1. Take your time. Latest question. Yes, net reproduction rate. We have seen girl children minus mortality, girl children minus death. So I can say surviving girl children. So total number of daughters or girls produced minus death, surviving girl children in the country. Dependency ratio, non-earning by earning. So we can say FMGE and National Board of Examination. So less than 15 year, more than 65 year, rest of the population. Will you be able to calculate if a numerical is given? Will you be able to calculate? Directly apply the formula. So look at this question, friends, carefully on the screen. This is numerator. This is also your numerator. So total numerator is 40%. Rest of the population will be 60%. 0.66. 66 non-earning depend on 100 earning for survival. Right? Okay. What is the shape of a developing country's population pyramid? I need the technical language because they may not show you the diagram. Yes, Dr. Prakhar is right. It is an upright triangle having a broad base, narrow top. In contrast, developed country, it is having more people in the middle economically productive age group, very right. So this is spindle shape having a bulge in middle. This shape is representative of fertility pattern. So developing countries have high fertility, developed countries have low fertility. Span is life expectancy. So you will have taller pyramid in developed countries, life expectancy. Symmetry tells you sex ratio. In India, we have female feticide, so we have asymmetric population pyramid. Can you tell me which are the only two parts of the country where there is no female feticide? दो ही पढ़ी लिखी जगह है इंडिया में जहां पर फीमेल फिटिसाइड नहीं होता, बाकी सब एक जैसे यूजलेस है. दोज टू प्लेसेस आर केरला एंड पौंडीचेरी. ओनली टू प्लेसेस where sex ratio is more than 1000 is Kerala and Pondicherry, right? Okay, take your time. We are being asked dependency ratio. We know non-earning by earning. So when you look at this question, can you tell me how many are non-earning? Less than 15, more than 65. How many are 15 to 65 denominator? 1, 2, 3. So 0.66. It should never be expressed in percentage. Many of you are giving wrong answer. It is never expressed in percentage, but when question came in your paper, it was actually like this. So it is 0.66 or 66 by 100, right? Contraceptive failure and efficacy are assessed by Pearl index. Can you tell me the numerator of Pearl index? Numerator only. Yes, number of accidental gestation upon total months of exposure into 1200. It is expressed per 100 women years. Who is a eligible couple? It is currently married couple where wife is in reproductive age group. Couple protection rate. Protected couples divided by, what is the denominator? See, this is how exam will suddenly throw up a new question in front of you. Protected couples by eligible couples into 100. What is the content composition of a single pill of Mala and Malady? Okay, after this topic, we'll have a 5 minutes break. Yes, 30 microgram estrogen, 150 microgram progesterone. What about the last 7 pills? Content composition. फोलिक एसिड नहीं होता इसमें, फोलिक एसिड नहीं होता. आयरन है कितना है और कौन सा सॉल्ट है, ये पूछा गया था आपसे. इट इज 60 मिलीग्राम फेरस फ्यूमरेट. आईएफए टैबलेट में फेरस सल्फेट होता है, यहां पे फ्यूमरेट होता है. माला एन इज फ्री and malady is chargeable, right? Okay. Can you tell me which 3 cancers are reduced due to OCP? Which 3 cancers are increased due to OCP? So when we look at combined oral contraceptive pills, They reduce which three important cancers? Yes, you can say CEO. So it reduces colorectal, colonic, endometrial, ovarian. But it increases breast carcinoma. That is asked every time in your exam. It also increases cervical and liver cancer. आपके एग्जाम में जरूर आएगा. Now, what is the answer to this particular question that is on your screen right now? आपको एक क्वेश्चन भी ध्यान से पढ़ना है. Not reduced is cervical. Other three are definitely reduced. Okay. Contraindications to combined OCP usage includes. Contraindications to combined OCP usage includes. उसी क्वेश्चन को, दिस इज योर जनवरी पेपर क्वेश्चन, दे स्लाइटली मॉडिफाइड द लैंग्वेज. ओल्डर क्वेश्चन. विच ऑफ द फॉलोइंग अलाउज सेफ यूसेज? किसमें कोई प्रॉब्लम है ही नहीं. HIV, there is no issue with combined oral contraceptive pills, but otherwise cardiovascular diseases, hyperlipidemia, they create problems. Estrogen is the issue. Which of them is available in RCH program of India? Many of you are giving wrong answer. Few of you are giving correct answer. It is not 2. It is 2 and 3 both. When we look at 2 and 3 both, 2 is copper T 380A having a shelf life of 10 years. This is multi-load copper T 375 shelf life 5 years. And what is these numbers? What are these numbers? One is Myrina, okay. What are these numbers? Surface area of copper. This DMPA is dipomedroxyprogesterone acetate. What is the dose? Irregular cycle is the most common side effect. Dose is 150 milligram intramuscular once every 3 months. New name in RCH program is Antra. What is the technique shown in the image? What is the minimum length of the structure which is cut? This is no scalpel vasectomy, minimum 1 centimeter. Most useful advice after vasectomy. Barrier methods should be used for 3 months. And what else? Anyone? Yes, Dr. Abdul is right. Semen analysis should be done later again. Most common cause of failure. Most common cause of failure in vasectomy, if it occurs, is yes, misidentification of vas deferens by the surgeon. Misidentification. Chaya is the new name of Saheli. What is the unique feature of Saheli or Chaya? It is India's only non-steroidal, non-hormonal OCP. Central Drug Research Institute, Lucknow. Contraindicated in PCOD, having a very high failure rate or Pearl index. Antra we have discussed DMPA. Nishya we have discussed is home-based urine pregnancy testing kit. Right? Okay. Read this question. IUD insertion, woman presents with bleeding. Reassurance is a wrong answer. अगर आप सिर्फ reassure करते रहोगे, bleeding होती रहेगी, she will land up into severe anemia. You have to supplement iron. Ferrous sulfate 200 milligram TDS is given for 8 weeks. If iron supplementation observation is not in the choice, then you can do reassurance. But reassurance only will not help the woman. You have to supplement the iron also. इसीलिए make a habit of reading all the 4 choices. नहीं, रिएश्योरेंस करना है कि दिस इज नॉर्मल, बट रिएश्योरेंस को मैनेज भी तो करोगे। रिएश्योरेंस करके घर भेज दोगे, फिर वो सडनली कॉम्प्लिकेशन सीवियर एनीमिया में वापस आएगी। राइट, ओके, डिपेंडिंग ऑन द ऑप्शंस। ओके, students are asking from break. Let's quickly take a 5 minute break. 12:29 it is. 12:34 it will be. So water, washroom, tea, coffee, smoking. 5 minutes later we are meeting again. No lunch break. Lunch break will be at the end of the class. how to go through PYQ fast. Question answer. Do not waste time on explanation. If a question is very easy and still you mark it wrong, then go through the explanation, right? Okay. Environment. Can you identify the instrument and tell me its use? Six white cups, one black cup. We are talking of Horrocks apparatus, which is used for chlorine demand estimation. How much bleaching powder is required by water? Now, what is the indicator starch iodide? Anyone remembers the formula? Although it will not be asked, N into 2 grams of bleaching powder can disinfect 455 liters of water, where N is the number of first cup to show color change. Can you identify this instrument and what is its use? This is chloroscope, which is used for residual chlorine level. Quickly tell me the level in drinking water, swimming pools to kill cyclops post disaster. Four different questions. Drinking water minimum zero point 0.5 milligram per liter or ppm, contact period 1 hour. Swimming pools 1, cyclops 2, post disaster 0.7, preferably above 1. Right? Okay, good. All of you are right. Water sample collection. You have to follow certain guidelines. Which is the answer to this question? Is D. Why not A? Leaking taps should not be used. We should use taps which are fine in use and you have to sterilize by heating with Bunsen burner. Why B is wrong? Because not 1 minute, 2 minutes. You have to allow water to run waste. Water sample is container is kept close to tap. No, it should be slightly away. Otherwise, you will end it and end up contaminating it. Right? Okay. Doctor patient sitting arrangement is seen, which is true with regards to transmission of droplet infections, which is true is C. Can you tell me why 2 is better for the doctor? Because here, if you look, see, this is window, this is door. So in ventilation, air will pass from window to door or door to window. Now look at the first image. Doctor is directly in the firing range of the patient. Whereas in second, doctor is outside the firing range of the patient. So more chances of transmission is in 1, lesser chances of transmission is in 2. Maintain 1 arm's length from the patient. Right? So maintain 1 meter distance from the patient. Right? Ventilation. Upper one is sling psychrometer. What is it for? Used lower one, rate is used for low air velocity. Earlier it was used for cooling power of air. Cooling power of air. Two instruments have been asked from air in your paper. These are the two. Can you tell me what is shown in this image? Okay, there was a lag. Okay. So just remember sling psychrometer, air humidity, kata thermometer, low air velocity. If doctor and patient are in the line of the air transmission, then more chances of contamination and more chances of risk to the doctor. If doctor is outside the firing range, that is number 2. Now he is away from the movement of the air. Yes, this is National Air Quality Index. So good is 0 to 50. Then 51 to 100 is satisfactory. Then there is a gap of 100 each. Can you tell me in which of these categories there will be a problem to respiratory disease patients and cardiovascular patients? When will they feel the discomfort? That you have to remember. Yes, moderate category 101 to 200. It is respiratory and cardiac patients who also start feeling discomfort. Sound. Can you tell me direct tympanic membrane rupture occurs above 150 to 160? What is the tolerable sound level in hospital wards of India? Anyone tolerable sound level in hospital wards? 20 to 35. Light. Can you tell me brightness of point source is measured by which SI unit? That is by candela. Housing. Can you tell me what are the three criteria for overcrowding along with cutoffs? Criteria include if floor space per person is less than 70 to 90 square feet or more than two people per room or sex separation above 9 years is absent. Radiation. What is the thickness of lead apron minimum? Lead apron should be minimum. What thickness? 0.5 millimeter. State receiving maximum solar radiation in the country is Rajasthan. Waste disposal. Can you tell me most sanitary method for refuse disposal? Landfill, also known as controlled tipping. What is the depth of water seal in RCA Sanitary Latin of India? 2 centimeters. Can you tell me strong sewages if BOD is more than 300? Good. Easy question. Disease transmitted by this vector. Only C. C and D also. Japanese encephalitis is through Culex. Malaria is through Anopheles. Chikungunya can also be transmitted by besides Aedes, Mansonia. This is tiger mosquito Aedes, which can transmit dengue, chikungunya, yellow fever, Zika virus, and Rift Valley fever. This is Anopheles. What is the reason this is Anopheles? 45-degree to the surface of skin, having black spots on margins of wings. This is Aedes, sitting parallel with a small bend around the neck, having tiger appearance. Aedes. Culex also sits parallel with a bend around the neck, but it is not having tiger-like appearance of Aedes. Diseases we have discussed. Identify A and B. What is the answer to this question? Choice number B. Anopheles larvae rest parallel to water surface because they don't have siphon tube. Aedes culex rest at an angle. How will you differentiate Aedes and culex by chance if they ask you this time? Aedes culex larva, because both are at an angle. See, let me put it like this. Let us suppose this is the water surface and this is one larva. This is second larva. 1 and 2. Can you now tell me? Yes, one is ADs, smaller siphon tube. Two is Culex, larger siphon tube. A comes before C in alphabets also. So AD is smaller, Culex larger siphon tube. This is all three are same. Sandfly. Right? So legs two times longer than body. Fine hairs on margins of wings. Diseases kala azar, oriental sore caused by tropica, and cutaneous, mucocutaneous also. Sandfly fever, Oraya fever, many diseases. This is rat flea. Dorso-ventrally compressed, neck is absent. Two important diseases it transmits, plague and what is the other disease, friends? Endemic typhus. Most dangerous कौन सी होती है? Open flea, blocked flea, partially blocked flea. It is partially blocked flea. Potential explosiveness is known by which indicator? Yes, Chiopis index. How many Chiopis are there per rat? You have to count. Paris green powder is used for killing of anti-larval stomach poison, Anopheles larva. It is an anti-larval stomach poison. Preventive outfits. Ideal number of antenatal visits should be ideal 12 to 14. Minimum number of antenatal visits should be 4 according to RCH program, 8 according to WHO. Postnatal visits are undertaken by multi-purpose worker female ANM. Home delivery 4 visits, institutional deliveries 3 visits. So 3 visits on day 3742. Home delivery additional on the day of delivery. Otherwise, ASHA worker has to come through another health program, home based newborn care. How many visits she has to take? 6 visits in institutional delivery. 3, 7, 14, 21, 28, 42. Additional visit, 7th visit is on day 1. Right? Read carefully. Read carefully. We cannot do mistake in this type of question. Maternal mortality rate. Why not maternal mortality ratio? Because that is per 1 lakh live birth, right? So reproductive age, rate, live birth, ratio. Ratio is more commonly used on the planet. All of them have same denominator, live birth. But MMR has a different multiplier of 1 lakh. Can you tell me latest values of the upper three? IMR, MMR, at least IMR, MMR, latest we should know. IMR is now 24, MMR is 87. This we should definitely remember. Low birth weight prematurity is commonest cause of which of the following? Is the commonest cause of IMR, under 5, neonatal, and perinatal also. If you look at maternal mortality, then its commonest cause is PPH. Abruptio placentae and maternal infections for stillbirth rate. Can you tell me quickly best indicator for health services availability, utilization and effectiveness? कौन सा इन सब में से? IMR. Socioeconomic development. Socioeconomic development is under 5 mortality rate. So you are right when you say IMR is actually the best indicator of these 5 along with ASHA also. So health services, health status, state failure and ASHA. Socioeconomic development is under 5 mortality rate. Combined maternal newborn, combined perinatal because it is 28 weeks till 5 days. Virulence or killing power, case fatality rate, communicability, second day attack rate. I am putting all questions on a single slide. Cost effectiveness is measured by Kelly. These 5 malaria indicators we have already discussed. So just go through this list once. Calculate neonatal mortality rate. Neonatal mortality rate is total neonates, early and late. So early neonatal deaths, late neonatal deaths upon total live births. So total live births are total births minus stillbirths in 2000. So that is 200 by 4000 in 2000. Answer is 50. If they change the numbers, we'll be able to calculate. If they ask you what is the early neonatal mortality rate of this population, what will be the answer? Early. Early कितना होगा? Yes, absolutely. Early deaths only will be counted. So answer will become choice number A. 12.5 per thousand live births. MMR. Please remember, do not include accidental deaths. So it will include obstructed labor, yes, shock, PPH, but not snake bite or electrocution. So total 4 upon live births into 1 lakh. Choice number B. IMR, MMR calculation, relative risk calculation will be asked in the paper. Can you tell me which 5 diseases are covered under IMNCI, where target beneficiary is 0 to 5 years? 5 diseases. We have diarrhea, pneumonia, malaria, measles, malnutrition, along with their complication. Can you tell me who is the target beneficiary of RBSK? What does this program cover? BAL, Rashtriya BAL. So child 0 to 18 years, 4 Ds. Diseases, deficiencies, defects, disability and developmental delays. Mobile clinic, Ayush medical officer is the head. Total 32 disorders screening is done. Rashtriya Kishore Swasthya कार्यक्रम. Kishore is adolescent. Anyone who remembers all the 7 C's: clinic, community, communication, content, convergence, coverage, and counseling. Total 7. Navjat Shishu, 0 to 7 days, training program for all levels of healthcare personnel. Nutritional Rehabilitation Center. Which disease is covered for 0 to 5 years? Severe acute malnutrition. Home-based newborn care. Postnatal visits by ASHA. FBNC, facility-based newborn care. So home-based newborn care, facility-based newborn care. Low birth weight is less than 2.5 kilogram. No, not 2.8, 2.5. Moderate is below 2. Very low birth weight below 1.5. Extreme is below 1. In your exam, these 3 have been asked. Birth weight doubles by 5 months, triples by 1 year. Low birth weight is around 18% in the country. Preterm, post, preterm, term, postterm. Any of them can be low birth weight, but which is included in definition of small for gestational age? Which of them is included when we are classifying small for gestational age? Term and postterm, very right, these two. Preterm is not included. Most common cause is IUGR for small for date. First one is Salter scale. What is the second one? Salter scale is for weight of a newborn or infant. And second one is infantometer, birth length. Exclusive breastfeeding should be done till 6 months of age. Most abundant is secretory immunoglobulin A, otherwise it contains all the fives. Essential fatty acid, brain development, myelination, only found in breast milk. Is yes, docosahexaenoic acid. मोस्ट डेफिशिएंट विटामिन, सोच के आंसर करना है, सबसे कम क्वांटिटी किस विटामिन की होती है? इट इज विटामिन डी. एनर्जी प्रोटीन कंटेंट 65 किलो कैलोरीज and 0.9 to 1.1 gram per 100 ml. Human milk is rich in lactose, iron, water, and calcium phosphorus ratio. Cow's milk is rich in proteins, fats, energy, calcium, phosphorus separately. When will you initiate normal vaginal delivery breastfeeding? Similarly for cesarean section. In both, as soon as possible. In normal vaginal delivery, maximum within 1 hour. Cesarean within 4 hours. If possible, start it at delivery table itself. Take your time, but mark this answer correct. कितना टाइम लो, इस क्वेश्चन में आप गलती नहीं कर सकते. A, B, C or D? B. If you say wasting is B, then why not A? What is A? Yes, that is clinically known as underweight. Why not C? That is stunting. Which of them represents acute malnutrition? Which of them represents chronic? So wasting is acute, stunting is chronic, underweight is acute on chronic malnutrition, both together. Anyone who marked these things wrongly in this question, please correct it. Because this comes in your exam, we have to know it correctly, right? Okay. In WHO growth chart, upper line is equivalent to, upper reference curve is equal to what percentile of boys? 50th, 80th, 90, 95th, 97. That is 50th. Lower reference curve is equivalent to third percentile of girls. In between is road to health. Lower line is -2 standard deviations below 80% of the value based on NCHS standards. So when we look at WHO growth chart, passport to child's health, can you tell me without looking at the screen normal IQ? That is 90 to 109. Also, you have to remember three more: idiot, imbecile, moron. So 0 to 24, 25 to 49, 50 to 69. Only in mental retardation classification, normal IQ is 70 or above. Most common cause of mental retardation क्या होता है? Yes, Down syndrome. On left side is ICDS. On right side is midday meal program. What is common to both of them is nutritional supplementation. How much calories, How much proteins? Can anyone tell me? In both it is same, but how much? Yes, Dr. Iyer is right. One third calorie, one half protein. This is Ministry of Women and Child Development. This is Human Resource Development. Now education. When we look at ICD, it has four beneficiaries. Children below 6 years, then non-pregnant, non-lactating women, pregnant lactating women, adolescent girl 11 to 18. One community development block of ICD is equal to how many villages, how much population? Anyone? FMG question. Yes, 100 villages, 1 lakh population. Midday meal program, if you know, there are two groups, primary, upper primary, who require 450 kilocalories, 12 gram, and 700 kilocalories, 20 gram. Can you tell me amount of cereals each child requires in primary and upper primary? FMG question again. Midday meal program, how much grams of cereals are required? 100 here, 150 gram here. Cereals. Right, good. When we say give up everything before the exam, that is weighing you down. This includes actually any type of FOMO. Right? So remember, if you have worked so much, put in so much hard work, result will come positive for you, definitely. Nutrition. What is the richest source of essential fatty acids? Anyone? Safflower oil. Proteins, anyone? Proteins. Highest content is found in soybean 43%. Saturated fats, coconut. Vitamin C, Indian gooseberry, amla. Vitamin D and vitamin A. Yes, halibut fish liver oil, iron, dried pumpkin seeds. Then a lot of values come. I am underlining questions of your exam. How many of you know all the three values, all the values on the screen? Because this is minimum what is asked from you in the paper. Good. So 2100, 27, 3500 kilocalories a day. Adult woman sedentary moderate heavy 17, 21 and 2700. Protein requirement 0.83 gram per kg per day. But when we look at separately total requirement for adult man woman, that becomes 54 grams per day and 45 grams per day. In pregnancy, additional is 350. Lactation first half, lactation second half. Infant 550 and 670. So 550 and 670. You have to know because these are not complete. Beside this, you will be asked about four important nutrients. Iron in milligram per day. Pregnancy is 40. Iodine 150, 150, 250, 280 microgram per day. Vitamin A microgram per day of retinol equivalent. Anyone remembers? Yes, lactation iron is 23. Vitamin A, adult man, you should know how much it is. Anyone? Yes, 1000, 840, 900, 950, 600 international units per day. Which other important nutrient like vitamin D has same requirement in all the four groups? कौन सा और दूसरा न्यूट्रिएंट है? कैल्शियम नहीं है, फोलिक एसिड नहीं है, Dr. Arpita is right, fluorine. Diagnose. This is pellagra. This is Castle's necklace. Which group of people it is seen is maze eaters, where tryptophan to niacin conversion ratio 60:1 K pathway due to deficiency of tryptophan. But real problem, pellagrogenic amino acid, is excess of leucine. How many of you knew all these questions what are written on the screen? Because pellagra is a favorite topic of your examiner. Okay, good. Anyone remembers all the 4Ds correctly? This one. This is asked in the paper. Diarrhea, dermatitis, dementia, disability, death. Which is wrong? Diarrhea, dermatitis, dementia, disability, death. Which is wrong? Disability is not included. So diarrhea, dermatitis, dementia, death. Fifth is delirium. Sixth is depression. So diarrhea, dermatitis, dementia, death is 4Ds. Fifth is delirium. Sixth is depression. Latest question. Flocculation is one of the most important things in defloridation, which plays a major role in that. Alum. Because it is alum actually, which causes coagulation. What is the sequence of chemical addition in Nalgonda technique? Who gave Nalgonda technique? Mnemonic is lab. Given by National Environmental Engineering Research Institute, Nagpur. Recommended level of fluorine. 0.5 to 0.8 milligram per liter or ppm. Acceptable is 1 to 2. Dental above 1.5. Which tooth is affected first? Molar canine. ये कहां से आ गया भाई आंसर? It is upper central incisor. Upper central incisor is the first one to be affected. Skeletal fluorosis 3 to 6. Crippling आपके इस वाले पेपर में दोबारा आएगा. Crippling fluorosis occurs when the cutoff of fluoride intake consistently is more than 10 ppm or 10 milligram per liter. How many of you remember complete composition of an average hen's egg? It has 6 gram fat, 6 gram protein, 30 milligram calcium, 1.5 milligram iron, 70 kilocalorie energy, 250 milligram cholesterol, making it the richest source of cholesterol. Net protein utilization 96. This is also the reference protein of India. Soya bean, highest quantity 43.2%, 432 kilocalories per 100 grams soya bean. But quality more important, so egg is reference protein. Source of thiamine in diet. Is rice. So thiamine deficiency seen in people who are polished rice eaters. When we are looking at beriberi, when we look at Wernicke-Korsakoff psychosis, that is seen in alcoholics. A student is asking what is C? क्या है भाई बता दो. What is C? खीर, रायता, दही, दही बड़ा. ओके, जो मर्जी सोच लो. Curdy white discharge of candidiasis you have to remember, right? Okay. Neural tube defects. What a pregnant female in preconception period would you advise her to take? Is folic acid. 4. Level of prevention this is. Level of prevention this is. प्राइमरी सेकेंडरी कैसे हो जाएगा भाई प्राइमरी है रिस्क फैक्टर इज प्रेजेंट एंड यू आर गिविंग टू प्रिवेंट एन आउटकम इन प्री कंसेप्शन पीरियड प्राइमरी स्पेसिफिक प्रोटेक्शन दिस इज xerophthalmia can you tell me what is shown in image 1 what is shown in image 2 image 1 shows dry eye conjunctival xerosis characteristic receding banks after a sea-tide appearance. So wavy lines on sand after a wave goes back. What is seen in second image is many times asked bite dot spots. Can you tell me WHO category of both? When we look at the WHO classification of xerophthalmia, of both you have to tell me. This is X1A, this is X1B. If bite dot spots are more than, when it is a public health problem, if night blindness is more than. Tell me both the values. No, 10 is not correct. Bite dot spots, Dr. Krishna is right, more than 0.5%. And night blindness if more than 1%, not 0.1. Many of you are telling me wrong answers here. I'll again repeat. In a community, if you want to see whether xerophthalmia is a problem, look for prevalence of bite dot spots, night blindness, more than 0.5 and 1. Definitely it is a public health problem. इससे आसान क्वेश्चन क्या ही होगा सब कुछ आपको लिख के दिया हुआ है एडीमा ऑल फ्रॉम अ सेम विलेज मस्टर्ड सीड्स सब कुछ बता दिया उन्होंने कुछ नहीं छोड़ा दिस इज एपिडेमिक ड्रॉपसी व्हाट इज द टॉक्सिन व्हाट इज द टॉक्सिन ऑफ ड्रॉपसी yes sanguinarine which inhibits oxidation of pyruvic acid. Can you tell me what are the manifestations? Edema, congestive heart failure, glaucoma, death. Stored groundnuts, aflatoxicosis. If they tell you stored cereal grains, then ergotism. Ergotism, the organism is claviceps. Aflatoxicosis, it is. What is the organism in aflatoxicosis we can isolate? Aspergillus. Gait, using a stick. Meals containing rices and pulses. कौन से विटामिन से सप्लीमेंट कर सकते थे सी विच डिजीज आर वी टॉकिंग ऑफ न्यूरोलेथेरिज्म ऑस्टियोलेथेरिज्म अर्गोटिज्म और इज इट एपिडेमिक ड्रॉपसी न्यूरोलेथेरिज्म osteoletherism is seen in animals so this is one stick stage two stick stage of neuroletherism this is crawler stage vitamin C has a good role in prophylaxis and treatment also. When we look at these images, which diseases or which disease am I trying to depict when I show you these purple colored, which can destroy the crop? Ergotism. What is shown on the image on the right side for ergotism? Household level, you can diagnose and separate also the ergot from the cereal grains. That is by using, you have to remember concentration also, 20% salt or brine solution. Questions will be very lengthy. I'll again tell you answers will be very simple this time. Okay, go through this question. देखो एरिथमेटस स्केली पुशुलर इन पेरीओरल या तो पेरीओरल एरिया में हो या फिर जेनाइटल एरिया में हो और डायरिया की ऑलरेडी हिस्ट्री है वी आर लुकिंग एट जिंक डेफिशिएंसी व्हाट डज आयोडीन डेफिशिएंसी लीड टू एनीवन Iodine deficiency has many manifestations: goiter, cretinism, hypothyroidism, mental retardation, in pregnancy, stillbirth, abortions. What does copper deficiency lead to? Anyone? नहीं, विल्सन तो है, मैं तो पब्लिक हेल्थ की बात कर रहा हूं, विल्सन तो है आपका पब्लिक हेल्थ PSM. What you will confuse it with when you are sitting in a primary health center, वहां पे आप मेजर नहीं कर सकते बाकी कोई भी लेवल. So when you are sitting in a primary health center, we are confusing it with pseudoscurvy. We are confusing it with scurvy. Vitamin C. Similar manifestation. Selenium deficiency leads to endemic cardiomyopathy, commonly known as Cation's disease, right? Addition of vitamin A to butter is an example of food fortification. Now, anyone who knows difference between these four, because this was a new question likely to be repeated or modified this time. What is food fortification? We add something from outside to correct micronutrient deficiency. Earlier, there used to be very popular dalda, even that is used even today. So it is fortified with vitamin A and vitamin D. Food adulteration, we know. Mixing of an adulterant in a food item. What is food enrichment? Anyone? Name is telling you. What is food enrichment? If they change the example this time. नहीं, एनहेंसमेंट तो आप फोर्टिफिकेशन में भी कर रहे हो, एनहेंसमेंट तो आप एडिशन में भी कर रहे हो, डिफरेंस क्या है? नहीं, समथिंग इज लैकिंग तो फोर्टिफिकेशन में भी था, इसलिए तो हमने ऐड करा. नहीं, यू हैव टू बी वेरी केयरफुल. व्हाट इज एनरिचमेंट? एनरिचमेंट इज when you add to complete the loss during processing. So earlier it was present in that food item, but when you process, like when you make flour or atta, then many vitamins are lost. So we add B1 to that atta, vitamin B1, B2, that is enrichment. What is food addition? एडिटिव होता है ना, कई बार आप लिखा पढ़ते हो फूड एडिटिव्स. व्हाट इज एडिटिव? इट इज टू इंप्रूव, इंक्रीज नहीं कहना चाहिए, इंप्रूव टेक्सचर, फॉर विच वी यूज emulsifying agents, or to increase shelf life, for which we add preservatives like salt, or we want to improve its look, so we add colors. तो डिफरेंस है, ध्यान से देखना आपको. Fortification is people consume few things, so you add vitamins to that or important nutrients so that they directly get it. Enrichment, nutrient was present, but when you process it, nutrient was lost, so we add it from outside to again make it complete. Addition is when you want to improve the texture, look, or the shelf life of the food item, right? Just go through it once, maybe it can help if there is a new question. Social sciences. What is shown in the image? What are its three components? This is modified Kuppuswamy scale used for urban families, and three components are education, occupation, income. Education and occupation is for head of the family. What is the score of the upper class? Uppermost class. Yes, Dr. Abdul is right. 26 to 29. This we have to remember. Urban families. Take your time. But this you have to mark correctly. We have discussed a shortcut also. I told you to remember this. We'll again repeat. This is Birth of last child to first child leaving home. Okay, we'll come back to this. Let's quickly look at this. What is formation? Marriage till first childbirth, first childbirth to last childbirth. Extension, last childbirth to first child leaving home, first child leaving home to last child leaving home is contraction, complete contraction, last child leaving home to death of spouse to death of survivor, extinction is dissolution. To remember, I told you, better is to focus on the starting point. Then you will never forget. Now, read the question again. Birth of last child to first child leaving home. Birth of last child. At that point onwards, it becomes complete extension. A newly married couple delivers their first child. They are in which stage of family cycle? A newly married couple delivers their first child. The moment child delivery occurs, they will move to the stage of extension, second stage of family cycle. Good. Nuclear family. One married couple with or without kids. Joint family. More than one married couples with or without kids. Males are related by blood. Three successive generations. नाम से ही पता चल रहा है. New family. Less than 10 years. Marriage duration. Communal family. Division of labor. Each member has a defined role in the management. Broken family, both parents not together. Death, divorce, legal separation. What is problem family, anyone? What is the key word in the definition, anyone remembers? Example nahi. What is problem family? Okay, that one which lags in progress. भाई शिल्पा शेट्टी चॉइस में थोड़ा ना होगा. So which lags in progress behind rest of the society. Health communication. Method, audience size, ideal duration. This is lecture chalk and talk method. Ideal audience size should be 6. 6 से क्या होगा भाई? 30 कम पड़ता है. And 15 to 20 minutes. Didactic, Socratic. Lecture is one way, two way, it is one way. So didactic. This is focus group discussion. How many participants should be there? 6 to 12. They have to draw a diagram of interaction also. That is known as sociogram. They have no audience. But if a group of experts is having audience in front of them, so we have experts, we have audience. That is panel discussion. How many experts should be there? 4 to 8. Audience can ask questions in the end. Socratic. Read the question. Answer. This is symposium. Panel discussion is a discussion. It's not lectures. Workshop is to teach, not only teaching, but training, skill development. Seminar is combination of methods. This is which method? Demonstration. Can you tell me which two principles it works upon? Seeing is believing, learning by doing. Seeing is believing, learning by doing. Right? Okay. What is the use of spikes technique in public health? Cancer. So, communication of cancer diagnosis and prognosis. What is K? Just to see if you remember the abbreviation. Set up interview, assess perception, invite to explain. K is knowledge, emotion, summary, strategy. Gather approach is used for contraceptive counseling. What is H? H. Greet the couple. Ask. Tell. H is help them choose the method. Explain. R is return visit. Cafeteria approach. Older name. This is a concept we have discussed in the class. Health education affects the thought process. When you're trying to put an idea in someone's mind, that is a type of health propaganda. Can you tell me which type of behavior is seen and what does it affect? Behavior seen and what does it affect? Yes, behavior is reflexive here. In health education, it is reflective. And whereas health education is based on reasoning, health propaganda is based on affecting the emotions of the person. Right? Okay. This we have discussed. Cannot understand few technical words. Language is not the problem. Few technical words. Semantic barrier. If whole language is a problem, that is linguistic barrier. Linguistic barrier. Tourist group headed by a tour guide. It is a herd. Can you answer in a single word? Single word I am looking for. Why it is not a mob? Single word. नहीं लीडर तो यहाँ पे भी है मैंने इसलिए कहा था सिंगल वर्ड आपको आंसर करना है मॉब इज इमोशनल टूरिस्ट ग्रुप में कोई इमोशनल नहीं होता राइट ओके क्राउड हैज नो लीडर एंड वाई इट इज नॉट अ बैंड एनीवन वाई इट इज नॉट अ बैंड बैंड इज नॉट इंडिविजुअल्स बट ग्रुप ऑफ फैमिलीज लिविंग टुगेदर ओके ये देख लो फटाफट देन यू कैन आंसर लेटेस्ट क्वेश्चन है इट इज बिलीव्ड that which of the following foods can lead to abortion papaya can you tell me besides papaya similar misconception is about another food item that is pineapple then they say if you increase ghee intake it will lead to better delivery अब they say the birth canal gets lubricated right so these are some of the myths and misconceptions which are there if you take saffron milk in pregnancy then the child born will look like a European. Albinism हो सकता है वो right? So saffron milk increases fairness of the child. This is also a misconception. Right? Okay. You tell the country anything तो भी पी जाएंगे सब right? So this is misconceptions related to food among pregnant females in the country. Pregnant females in the country. Is lag in video right now? My friends are okay. Lag is there. इतने स्टूडेंट यार लैग होना नहीं चाहिए बिकॉज एट माई एंड इंटरनेट इज गोइंग फाइन ओके Is it fine now? Okay. Which is the pneumoconiosis if we look at the workers in the image? This is shipyard workers. So we are talking of asbestosis. Very right. Can you tell me? So many clues were given in the image: sand mine, sand blasting, Kota stone factory, chest x ray having snowstorm appearance. So we are talking of silicosis. Silicosis, right? Textile industry workers. Quickly do matching, which will come in your paper. Matching, a lot of questions will come. Silicosis, no, textile industry is bicynosis. Sugar mill, bagasosis. Coal miners, anthracosis. Glass and cement industry workers. When we look at glass and cement industry workers, it is silicosis. Bauxite miners, also silicosis. Shipyard workers, we have already seen asbestosis. When we look at clinical association, mesothelioma, बहुत पॉपुलर क्वेश्चन आपके एग्जाम का. Mesothelioma, very good. Asbestosis, also lung cancer. Tuberculosis, some studies say silicosis. What is the organism you find in bagasosis? Thermoactinomyces sacri. Farmer's lung, micropolyspora. Compost lung, aspergillus. Chemical control of bagasosis. What is the answer? Chemical control of bagasosis. Anyone? That is through 2% propionic acid. And bicynosis is most common in farmer, spinner, weaver, packer. Bicynosis is most commonly seen in farmer, spinner, weaver, packer. Spinners. Farmer में नहीं, spinners में. What is the answer to this question? ये तो आसान है. Aniline dye factory. Bladder problems. So, transitional cell carcinoma is most common. Can I say bladder cancer is the most common occupational cancer? Occupational exposure cancer. If no, what is the correct answer? Skin cancer, squamous cell carcinoma. Overall skin squamous cell. Otherwise, aniline dyes transitional cell bladder. What about PVC? PVC exposure. Anyone? Good, Muhammad Asif. It is angiosarcoma of liver. Angiosarcoma. Can you diagnose which disease? Lead poisoning. Look at national board image. It is smiling. But national board is not aware. Actually, this is Burtonian line. Chemical composition. Lead sulfide. It is mainly due to petrol through inhalation. Classical clinical presentation in emergency. Wrist drop, foot drop. Otherwise, there is pallor and lead colic also. But when you look at organic exposure, encephalopathy occurs. Then screening test, diagnostic test, drug of choice. Screening test is coproporphyrin in urine. Diagnosis, aminolevulinic acid in urine. Drug of choice, EDTA with dimercaprol. Prognosis, peripheral blood smear. Two changes in peripheral blood smear. One is basophilic stippling of RBC, blue colored punctate dots. Second is microcytic anemia. Good. Few things you have to learn through your older PYQs, MCQs. मैं आपको लिस्ट है 34 डिजीजेस की. आई कैनॉट आस्क यू टू रिमेंबर द लिस्ट ऑफ 34 डिजीजेस, बट इफ बर्न्स आर मोर देन 20%, It is counted in extended sickness benefit if burns are more than 20%, 20% से ज्यादा burns हो तो. ESI, Ministry of Labor, what is the definition of factory? More than 10 people working with power electricity, 20 or more without power electricity. Not applicable on defense, mines, railways. Contribution by employer, contribution by employee is 3.25%, 0.75% of wages. Center is to state is 7 is to 1. What is the duration of sickness benefit? Extended sickness benefit, enhanced sickness benefit, duration. Yes, good. 91 days, 70% wages. Extended is 2 years, 80% wages. Enhanced sickness, 7 days in vasectomy, 14 days in tubectomy, 100% wages. Maternity benefit, 100% wages for a duration of. What is the answer, friends? Yes, Dr. Muhammad Asif is right. 26 weeks of pregnancy. So you can say roughly 6 months. Factory Act, per capita space. What is the answer, friends? 500. What is the per capita space in a school class? School class, 10 square feet. In a house, we have discussed today. In a house, 70 to 90 square feet. Good. One safety officer in Factory Act should be for 1,000 workers. Welfare officer, 500. Work hour duration, 9 hours a day. Maximum 48 hours a week. With paid overtime, it can go up to 60 hours. Who is a child in Factory Act? Who is an adolescent in Factory Act? Child is, कौन है भाई? 0 to 14 years because that is the cutoff age for employment. 15 to 18 is adolescent. 18 above is adult. Identify which principle of primary healthcare it represents. Identify which principle of primary healthcare. Yes, this is a standpipe. Exactly this image came in your paper. And which principle of primary healthcare it represents? I'm looking at the chat box. Yes, it is appropriate technology. Can you tell me any other example of appropriate technology besides standpipe? Hundreds of examples are there. Yes, ORS, exclusive breastfeeding, respiratory rate elevation to diagnose pneumonia, kangaroo mother care, Shakir's tape, any cheaper technology which can give results just like expensive technology. Can you tell me 2 examples of community participation? One from India, one from China. India is Asha worker, selected from the same village. Chinese barefoot doctors were not doctors. They were actually rice farmers. Good. Read this question. Latest question. Rural urban healthcare delivery is improving, but when compared to urban, rural healthcare delivery is still lesser. Which primary healthcare principle or pillar is exploited or violated? Equitable distribution. देखो इक्विटेबल का यही तो मतलब है, रिच पुअर, नॉर्थ साउथ, anywhere same services should be given, but urban have developed, rural services have not yet developed. Equitable distribution, right? Primary level of healthcare is through PHC and subcenter. Secondary through CHC. Medical college and hospitals tertiary. Can you quickly tell me these 5-6 questions from which one of you will find in your upcoming paper? फटाफट इन 6 नंबर्स को बता दो जिनमें से एक आपके एग्जाम में आएगा जरूर. सब सेंटर, 5,000 in plains, 3,000 in hilly areas. PHC 30,000, 20,000. 1 lakh 20,000, 80,000. Can you tell me total number of PHCs in the country? Total number of primary health centers are more than 25,000. 0 to 2 beds at subcenter, 4 to 6 at PHC, 30 beds at CHC. Lowest level where a MBBS medical officer is available. Lowest level MBBS medical officer, PHC. Who is the health staff at a subcenter? नहीं, सब सेंटर पे आयुष नहीं होता. It is health worker male female, also known as multi-purpose worker male female. Multi-purpose worker female may be substituted by auxiliary nurse midwife. What is the basis of division of type A, type B subcenter? Subcenter. Yes, if delivery facility is present. So which of them has delivery facility present? Type B. PHC is based on number of deliveries per month. Up to 20, more than 20. Right? Okay. लॉजिकल क्वेश्चन. भाई क्या सोच के एग्जामिनर ने क्वेश्चन बनाया होगा? आयुष्मान आरोग्य मंदिर लॉन्ड्री सर्विसेज पे क्यों कुछ सर्विसेज देगा? राइट. सो न्यूट्रिशन डाइट यस, पोर्टेबल ड्रिंकिंग वाटर हेल्थ सर्विसेज यस. तो इन द एग्जाम रीड द क्वेश्चन केयरफुली मेनी टाइम्स. लॉजिक विल हेल्प यू मार्क द आंसर. कैन यू टेल मी these underlined questions of your exam? So let's quickly fill up this table. Questions which have been asked in your exams are these. Let's look at that. Asha is located at village health guide and traditional birth attendant also. Multi-purpose worker subcenter, Anganwadi worker at Anganwadi center. Population norm of Asha 2 per 1,000. If this correct answer is not in the choice, mark the older wrong answer 1 per 1,000. Multi-purpose worker is per 5,000. Village we take as 1,000. Anganwadi center is 400 to 800. When we look at education of Asha, minimum 10th pass, village health guide 6th pass, and training duration of Asha 23 days, and for traditional birth attendant 1 month. This table along with this table you have to know completely in detail. You will find questions in your FMG paper. Urban social health activist population norm 1 per 1,000 to 2,500. Pharmacist and lab technician. All these are FMG questions, please remember. This is 1 per 10,000 for both of them. Health assistant 1 per 30,000 in plains, 20,000 in hilly areas, because he or she is located at PHC. Doctor population ratio क्या है? Anyone? What is the doctor population norm in the country? 1 doctor per 1,000 population. So when they have to beat a doctor, 1,000 of them come. So 1 doctor for 1,000 population. Ophthalmologist कितना है? Yes, 1 per 5 lakh population, or you can say 5 CHCs, 5 community health centers. See, if you are a cerebellum student, we have made a mission of 200 plus. Even if you are a non-cerebellum student, you have to score minimum 200. So when you target 200, some mistakes will occur. Although you know the answers, there will be few questions whose answers may be marked wrongly by you in the paper. Don't worry about that. So when you target 200 moon, you will definitely cross 180. So, but you have to target 200 easily, right? Now let us wrap up the session in a quick manner. Health planning. Latest question. This is the question actually. Which of the following are going to be used? देखो, दिस वॉज एक्चुअली अ लॉजिकल क्वेश्चन. डेलीगेशन तो हम अपने काम से बचने के लिए करते हैं, और अ गुड मैनेजर डेलीगेट्स इनटू सबऑर्डिनेट्स, राइट? So please remember, planning, execution, evaluation are a part of planning cycle. So we have planning. If you look, you have execution, you have evaluation. So 8 steps of planning cycle. Delegation may be done for improvement or efficiency, but it is not a part of planning cycle. पहले से सोच के नहीं आते कि सब कुछ काम डेलीगेट कर देंगे और खुद कुछ नहीं करेंगे एचओडी की तरह. बट इट इज प्लानिंग, एग्जीक्यूशन एंड इवेल्युएशन. यू हैव टू रिमेंबर. 3 million plan was given by. Who gave 3 million plan? Bhor committee. What was the major contribution of Kartar Singh committee? Multi-purpose worker. Srivastava committee. Rome scheme. Village health guide. Health assistant. Referral services complex. Bands of semi-professional and para-professional health workers. Can you tell me quickly 5 important guidelines or recommendations by Bhor committee? Primary health center, 1 per 40,000. 3 million plan, 3 million beds for admission of patients. Comprehensive health care, school health, and social physicians. How many of you remembered all the 5? Because these 5 have been asked in your paper. Jungle wala 3 have been asked in your exam. Integration of health services. Ban on private practice by government doctors. Equal pay for equal work. Srivastava committee we have discussed. 2 recommendations of high-level expert group committee. Universal health coverage. 3.5 year rural graduate MBBS course. Actually, it is Bachelor of Rural Healthcare. Dr. Sumant is right. Management पे आते हैं. What is cost effectiveness analysis? Anyone? Effectiveness का क्या मतलब है? I'm looking at the chat box. आउटपुट तो होता है, बट आउटपुट तो आप और भी बहुत तरीकों से मेजर कर सकते हो. Yes, it is in terms of results. When you measure it in terms of money, that becomes cost benefit analysis. बड़े ध्यान से पढ़ना एग्जाम में. Systems analysis, comparison of 2 or more cost effective alternatives. Network analysis is of 2 types: PERT, sequence of activities, and what is the most critical path, friends? What is the most critical path? Longest path in duration. Read the question. These are all fact based, therefore we are going faster. You want to see how much time his doctor is devoting to his patient. Sampling to assess quality of work. ध्यान से देखो, अदर टू वी हैव डिस्कस्ड. एफजीडी का इससे कोई लेना देना नहीं है, फोकस ग्रुप डिस्कशन का, राइट? ओके. फाइंड द क्रिटिकल पाथ. मैक्सिमम टाइम इज टेकन in machine installation, 10 months. Now suppose this time your question comes in a slightly different format. Look at the screen carefully, friends. Suppose I tell you that this is path number 1 and blue colored is path number 2. Which is critical? Which is critical? ब्लू कलर्ड पाथ नंबर 2, लॉन्गर ड्यूरेशन, जिसमें भी सबसे ज्यादा टाइम लगेगा, उसमें आपको क्रिटिकलिटी होगी. यू हैव टू मेक श्योर इट इज डन प्रॉपरली, अदरवाइज होल प्रोग्राम विल स्टॉप. सो क्रिटिकल इज द लॉन्गेस्ट ड्यूरेशन ऑफ द नेटवर्क एनालिसिस. ये लॉजिकल क्वेश्चन था, लॉजिकल आंसर था. ऐसे क्वेश्चंस में हम गलती एग्जाम में नहीं कर सकते, ब्लंडर हो जाएगा. बी. Ask 1 AM to make records, 1 AM to give vaccination. This is Division of labor. Read the other choices. Adding one vaccination carrier, एडिंग 1 आवर, जैसे सब कुछ आपके हाथ में, दुनिया जैसे मर्जी चला लो, राइट. रिमूव 20 चिल्ड्रन फ्रॉम लिस्ट, हिटलर थोड़ा ना. सो ask 1 a.m. to make records, 1 to give vaccination. It will become very fast because documentation also has to be done at the same time. Identify the two agencies along with their headquarters. WHO, UNICEF. WHO is located in Geneva, very good, and UNICEF in New York. What is C in UNICEF? Child, children. Nay, if we give a lunch break, na, then the class will be extended till 4 p.m. Let us complete by maximum 2:45. That is better. C is children. Very right. Can you tell me, I am asking question in a opposite direction. Applied Nutrition Program of India. What is the contribution by UNICEF? जीटी नहीं है, आज मॉक टेस्ट है, वो आपको इसके बाद देना है. Yes, they supplied seeds and manure to school children. Good. ये भी लॉजिकल क्वेश्चन है. इवन इफ यू रीड दी अदर चॉइसेस आपको समझ में आ जाएगा इसका आंसर क्या मार्क करना है. अर्लियर देयर वाज हेल्थ फॉर ऑल, देन मिलेनियम एंड सस्टेनेबल डेवलपमेंट गोल्स. सो व्हाई डिड वी चेंज दिस? लेटेस्ट एफएमजी क्वेश्चन. क्योंकि ओरिजिनल फेल टू अचीव द टारगेट्स. Think logically. Why will it only be for communicable, non-communicable, or poor people or developing country? These are global goals. Sustainable development, millennium development, all countries of the world. All countries of the world. Today's mock based on PYQ. No, it is not based on PYQs. There will be some parts of choices that will resemble PYQs. So, Sustainable Development Goals was given by United Nations. Target year 2030, 17 goals, only one goal number 3. Anyone can complete the targets which are asked in FMG paper or lot. 3 values I am looking at. Yes, MMR should be brought up to 70, under 5 12, 25, neonatal 12. So under 5 mortality 25, neonatal 12. Good. Can you tell me 6 category A bioterrorism agents? 6 category A bioterrorism agents. No, there are many targets. Many targets. We cannot remember all of them. Yes, smallpox. That is also the most dangerous, most commonly used. Anthrax, most lethal. Botulism. And beside this, there are plague, tularemia, viral hemorrhagic fever, Ebola, Marburg, Lassa. Category C, Nipah Hunter. What about COVID-19? That is not a bioterrorism agent. But can you tell me 3 answers? When we look at biosafety levels, there are 4 biosafety levels. Which one is for Ebola, tuberculosis, COVID-19? 3 questions. Biosafety level, which is for Ebola, is number 4. When we look at COVID-19, that is in category 2 also and 3 also. Single answer category 3. This is a better answer. And what about tuberculosis? Tuberculosis kahan pe hai? Where is tuberculosis? Yes, that is also in category 3. So focus on your exam question. Ebola is 4, TB is 3, COVID-19 single answer is also 3. Colombo plan. What was their contribution to public health in our country? Setting up cobalt therapy unit and also helped in setting up of and good. aims with the help of New Zealand. Immediately notifiable diseases are pes, polio, influenza, smallpox, SARS. They should be notified within 24 hours. Air travel in pregnancy is permitted up to how many weeks period of gestation? 36. If it is a twin diagnosis, 32. Carry EDD certificate after 28 weeks. What is health of international travelers? This science is known as science where we study health of international travelers. Ergonomics नहीं भाई. Ergonomics होता है man in his occupational environment. International travelers. Emporiatrics. Emporiatrics. This is biohazard. Biomedical waste. Second is radiation hazard. What is the radius of inner circle in this symbol? Good. 1.5 r. Third one is recycle. So your upcoming exam will be a recycling of the older PYQs. Only few of them questions will have a slightly different language. Paper will seem easy to you. पहली बार देखोगे लगेगा कि कुछ नहीं आता, but once you start reading the question, start attempting. Each question initially will seem difficult, but read the question. You will find all are doable. Many students will score 220 plus this time. Many of them. Biomedical waste. ये तो अभी डिस्कस किए. This is flood hazard. बाकी दोनों हम डिस्कस कर चुके. भाई मरकरी, दिस हैज बीन आस्क्ड सो मेनी टाइम्स. अब तो मरकरी खुद ही बाहर आके आंसर बता देगी स्क्रीन में से. दैट इज collect using paper, cardboard or plastic syringe, put it in water tube bucket, send it for recycling. Cotton swab कहां पे जाता है? येलो. वाई येलो? येलो में क्यों जाता है? इट इज अ टाइप ऑफ, कंप्लीट द आंसर. इट इज अ टाइप ऑफ. नहीं, मुझे आंसर चाहिए. ये आंसर नहीं है इसके. ह्यूमन, ऑर्गेनिक, कंटेमिनेटेड, सब कुछ कंटेमिनेटेड है फिर तो. यस, इट इज अ टाइप ऑफ सॉइल्ड वेस्ट. Any cotton or cloth material contaminated with pus, blood or any other body fluid. Now, can you tell me answer to this question of FMG? No. How many of you remember which waste goes into which four categories and their final disposal mechanism? Because all questions are based on this. So let us start one by one. Okay, before that, can you answer this question? Latest question. Such an easy question came. Expired medication. Yellow bag. Incineration. So let's look at this. Blue category, when you look, glassware and metallic implants. Pacemaker was asked in your exam. Final disposal mechanism is recycling. Why white category is a plastic puncture proof container? Anyone? Why white category? Because it is meant for metallic sharps, iron foundries. Red category includes plastic and rubber waste. So red category, if you look, it will be used finally by road making. Vacutainers will go into which category? Vacutainers. Red. Euro bag. Red. TPN bag. Red. Euro bag containing blood. Yellow. Otherwise, most of the infectious waste goes into yellow that we have discussed. Take your time, mark the answer correctly. A&M uses cotton syringe needle. What is true regarding disposal? We have discussed. Soiled waste in yellow bag. Why A is incorrect? By rule out wrong options also. Syringe is plastic, red. Needle is metallic, white. Black is not used in biomedical waste. It is used for municipal waste. Why B is wrong? Because vial is a glass. So it will go into blue, whereas translucent white is for metallic sharp. Syringe is plastic. It will go into red. Blue bag is for glassware and metallic implant. How many of you knew each and everything that I have written on the screen? Because that is what will help you mark correct answer in biomedical waste. Good, good to see. Latest question. TPN bag will go into, what should I mark? Red. Plastic and rubber contaminated recyclable. Many students kept on thinking they are showing tubes also. Definitely it must have some other answer. Do not overthink in the exam. इतना आपका examiner भी नहीं सोच सकता. Right? Simple questions. Keep it simple. Mark the answer correctly. Can you tell me temperature inside an incinerator and autoclave? 1200 good. Autoclave 121. But it is not high temperature. So how much time and pressure? 2 hours. Minimum 45 minutes. And how much is the pressure? 50. Most popular questions. How do you check sufficiency of autoclaving? We use spores of Geobacillus styrothermophilus. What about hydroclaving, friends? Hydroclaving की कैसे check करेंगे? Yes, Bacillus subtilis. FMG's favorite topic. Which method is used for conversion of this? No, incineration नहीं है, ध्यान से पढ़ना है. Inertization. And what are the chemicals used along with their concentration was asked. We use 15% cement, 15% lime. 65% is waste, 5% is water. Structures in the area can better withstand earthquake. So we are trying to minimize the damage. That is disaster mitigation. By sitting in marathon classes, you are doing disaster mitigation, true, false. This is true. So we know disaster is going to occur, but how much we can do damage control by taking some actions, that is known as disaster mitigation. तो आपका FMG एग्जाम ही डिजास्टर एक्चुअली. More than 30 students appear simultaneously. Arrange the following steps of disaster cycle in correct sequence. Yes, impact, response, rehabilitation, mitigation. Then another FMG question. We discussed the mnemonic. Recovery phase is RRR. Remember this, it will become easier. So when we look at recovery phase, actually it is characterized by 3 R's: response, rehabilitation, reconstruction. Otherwise, if they ask you risk reduction phase this time, then preparedness and mitigation. Okay. Triage is based on, when we categorize victims of disasters, it is on the basis of likelihood of survival. Ambulatory patients are in which category? येलो में नहीं, येलो में नहीं होते. एम्बुलेटरी आर इन ग्रीन, जो चल सकते हैं. येलो कैटेगरी is for 6 to 24 hours, but first 6 hours are given to red category. Please remember, start is in remote inaccessible areas. Lay persons can do. Reverse is in wars battle. Minor injuries should be treated first. Take your time, but mark the correct answer. B. If in this same question, suppose they say severe swelling on foot, painful laceration, she is losing blood very fast, she is going into shock, it will become red. If they say a 4-year-old girl is having fracture, we tie a splint, she can move about, green. If they say in a 20-year-old male there is pelvic crush injury, pelvic crush injury in a 20-year-old male. Bhai, how can you go wrong? Pelvic crush injury will be moribund patient. It will go into category D, not red. Pelvic crush injury, you have to be careful. Okay. Most common disease in post disaster phase कौन सी होती है? एक्यूट गैस्ट्रोएंटराइटिस, मीजल्स नहीं होती भाई, डायरियल डिजीजेस होती है, उसके बाद रेस्पिरेटरी आता है. सो टाइफॉइड, कॉलेरा. मोस्ट कॉमन विटामिन डेफिशिएंसी ए. वैक्सीनेशन विच इज कॉन्ट्राइंडिकेटेड, टाइफॉइड, cholera, tetanus. But in doctors, these three are mandatory. Otherwise, only which is allowed in post disaster phase or during epidemic, that is measles. Most important preliminary step. Diarrheal diseases are spreading. What will we like to do, friends? Yes, chlorination, 0.7. We have already discussed. What is on the left side? This one. Hardy-Weinberg law. What does Hardy-Weinberg law says? That frequency of genes remain constant from generation to generation. It is applicable in three situations. If it is large population, static population, random mating population. Any other condition, small, dynamic, assortative, selective mating, non-random mating, gene drift, gene flow, natural selection, mutation, it will not be applicable. What is on the right side? Punnett square. Mendelian cross breeding experiments. You can predict the genotype of offspring, right? Okay, good. Okay. Question number 13. We are talking of universal donor. Single answer O negative, but based on the choices, this is answer. What is universal recipient then? AB positive, right? Mental health. Most common mental health disorder in India. हमें डॉक्टर बनना है. तो what we are looking at is actually unipolar depression, followed by alcohol disorder, schizophrenia, and bipolar. So unipolar depression, alcohol, schizophrenia number 3, bipolar number 4. Most common substance abused, tobacco. Most common narcotic substance, आपने नाम भी नहीं सुना होगा इसका, that is cannabis. One word answers. Suicide rate in India कितना होता है? How much is suicide rate? Okay, 12 is fine, 12.3 है वैसे latest. And most common mode is even today hanging. We come to biostatistics. You will get 2 to 3 questions this time. High chances one will be from normal distribution, one will be from mean median mode, one will be from diagrams. Sampling का थोड़ा बहुत chance है. Let us look at all are measured on nominal scale except nominal scale is something which is based on names. Ordinal scale is order. Metric scale is measurement. So which of them is not measured on nominal scale is severity. Where should I classify severity? कहाँ पे रखना चाहिए severity को? Ordinal, mild, moderate, severe. What about weight and height of a person? Weight and height of a person. Metric you can measure. Marks you are going to score in FMGE exam. मेट्रिक. व्हेन आई विल आस्क यू द क्वेश्चन रिजल्ट कैसा रहा और आप बोलोगे सर मैं पास हो गया या पास हो गई, दिस इज अ टाइप ऑफ नॉमिनल स्केल. व्हेन आई आस्क यू आफ्टर द एग्जाम हाउ वाज एग्जाम, इजी मॉडरेट डिफिकल्ट, ordinal, easy moderate difficult, right? So we have understood. Good. This is the formula of, they will not ask you calculation, they ask you to identify the formula. स्टैंडर्ड डिविएशन इज अ रॉन्ग आंसर क्योंकि आपने फॉर्मूला देखा ही नहीं आंसर करने से पहले. आपने फॉर्मूला देखा ही नहीं आंसर करने से पहले. दिस इज काई स्क्वायर टेस्ट. एग्जाम में ये गलती नहीं करनी है. एग्जामिनर आपके दिमाग से नहीं चलता, अपने दिमाग से चलता है. सो वी हैव ऑब्जर्व्ड वैल्यू, एक्सपेक्टेड वैल्यू. ओ इज ऑब्जर्व वैल्यू, इज एक्सपेक्टेड वैल्यू. और सबसे बड़ी बात, आपके सामने काई स्क्वायर का लोगो भी बना हुआ है, तो एग्जामिनर इससे ज्यादा दयालु नहीं हो सकता. दिस इज काई स्क्वायर टेस्ट विच इज वन ऑफ द स्टेटिस्टिकल टेस्ट फॉर नॉन पैरामीट्रिक डेटा. दिस diagram is, okay, let's look at first three diagrams. Can you tell me 1 2 3 what are these? First is histogram, continuous quantitative data. What is second one? Frequency polygon. What is third one? Frequency curve. So identification only will be asked. We cannot go wrong. All three have same data, but polygon and curve have polygon and curve extra on top of the histogram. What about these two? This is line chart. What about fifth one? Although it's not asked in FMG, fifth one. Next one is after line chart, OGIF. And the sixth data diagram is this one, scatter diagram. Can you tell me which of these six statistical diagram is used for trend of a disease? Trend किससे पता चलता है? आई एम लुकिंग एट द चैट बॉक्स अगेन. यस, लाइन चार्ट. सो लाइन चार्ट आपको आंसर मार्क करना है जैसे आपको क्वेश्चन में वर्ड ट्रेंड दिखेगा. विच ऑफ देम इज यूज फॉर कोरिलेशन? कोरिलेशन के लिए कौन सा यूज होता है? स्कैटर डायग्राम. पॉजिटिव कोरिलेशन आर विल लाई बिटवीन, positive correlation R will lie between 0 to +1. Line has a positive slope. Line has a negative slope, negative correlation. R will lie between -1 to 0. If there is no line, no specific correlation, R is 0. Overall, correlation coefficient R lies between. Overall, correlation coefficient R lies between -1 to +1. Good. Can you identify these are? Can I say different types of histograms? No. These are different types of bar charts. Discontinuous data. So there is a gap between the bars everywhere. Simple bar chart, component bar chart, and multiple bar chart. So histogram, there is no gap between the bars. That is continuous quantitative data. Bar chart, there is always gap between the bars. Simple component, multiple types. This is pie chart. Is this the right diagram to show balanced diet? Yes. Protein should be 10 to 15%. Fat should be 15 to 30. This is web of causation. कैसे है भाई ये web of causation? कहाँ है इसमें? This is a spot map used by John Snow for the first time. This is, कोई भी एग्जांपल ले सकते हैं. This is a pictogram, any diagram, logo or photograph. So statistical diagram, quantitative diagrams you can remember by the mnemonic FLOSH. Frequency polygon, frequency curve, line, ogive, scatter, and histo. 6 types of statistical data diagrams. Latest question. Read carefully. You can see that as the salt intake is increasing, blood pressure is increasing. Scatter diagram. You are trying to see relationship between these two, correlation. Can you tell me this is which type of correlation? Positive, negative, absent? Positive. R will lie between 0 to 1. Very good. Mean निकाल दो is total sum divided by number of observations. 50 आ जाएगा. Median, middle value in ascending order. If you have two middle values, take its average. What is mode in this question? 50. If all three are equal, can you comment on the distribution? Very good, Dr. Sumant. Normal distribution. Bilaterally symmetrical, where mean, median, and mode are exactly equal to each other. Good. In normal distribution, one standard deviation covers how many values? Easiest question. 68%. Two standard deviation 95, three standard deviation 99%. Now mathematical calculation based questions will come. Read carefully. Range of two standard deviation. So mean plus minus two standard deviations will cover 95% of students. Now look at the range which is given. I think something is missing in the question. Range is given. They are not asking you to calculate. Without calculation, you can mark the answer. That two standard deviation is 124 to 128. So what should be the answer to this question? There is no need for any calculation because they are asking a fact-based question that we have shortly discussed. Yes, it is 95% of values will lie between this because it is two standard deviation. Why statement B is wrong? Can anyone tell me? Why statement B is wrong? No, how many values will lie more than 126? This is my question. Not 95%. देखो mean is 126. This. So how many values will lie above mean? 50%. Why A is wrong? Because 68% is not asked in the question. 95% has been asked. Two standard deviation. 68 covers one standard deviation. Study is not accurate. इतना नहीं सोचना एग्जाम में, ठीक है? Okay. This formula is standard deviation. Why? Because you have taken given value minus mean. So this is deviation. Then you have done squaring, squares of deviations. Then you have done total sum by sample size, mean of squares of deviation. Then you took under root, root of mean of squares of deviation, popularly known as standard deviation. याद रखना आपको, RMSD is popularly known as standard deviation. P value is significant if it is less than. Okay, let me give you choices. 0.005, 0.05, 0.55. Now this is the question. Yes, 0.05. So you can say 5%, but it is expressed in decimals. What is type 1 statistical error which is given by p value? Anyone? When will it occur? होता कब है? Null hypothesis true rejected, false accepted. It is null hypothesis is true, but it is rejected. Very good. Two different groups of children where we are comparing means. Question number 20. What should I mark? Good. Unpaired student t-test. If I compare mean weight before exercise, after exercise in one group of children, paired student t-test. If I compare mean weight in class 7 children, class 8, class 9, ANOVA. If I compare proportion of underweight children before and after an intervention, proportion of underweight children before and after an intervention, sign test. If I compare proportion of underweight children in boys and girls, chi-square test. Perfect. So you have remembered, you have understood. Can you tell me what is the answer to this question? One group of improvement after 3 months. That means before and after. Cholesterol level is a quantitative, so you will measure means paired student t-test. ओके फ्रेंड्स, अब तो ये बात बोलने लायक बची ही नहीं है, आप पढ़ चुके हो सब कुछ. जस्ट कीप ऑन वर्किंग हार्ड so that you feel proud after giving the exam. Make yourself proud, make your parents proud, make us teachers also proud. आपके जितनी मेहनत नहीं की बट हमने भी आपके साथ मेहनत की है. You keep on working hard, result will definitely come exactly what I predicted, more than 200. So just keep on working hard. Next 7 days, I'm not asking you to study 14 hours a day. Take complete rest. Food is important, hydration is important, everything. But time waste mat karna for next 7 days. You can write it on a stick-on, paste it on your table if you have not already done till now. You have to meet me at Cerebellum. फिर बातें करेंगे, right? 100%. Owl is considered very good for luck. So I always use this image, one of the favorite images of mine I have captured. So wish you all the best. घर वालों से बात करते रहना, दोस्तों से ज़्यादा बातें मत करना. सो फ्रेंड्स, ऑल दी बेस्ट, स्टे ऑन कोर्स, पढ़ते रहो, मेहनत करते रहो. बेस्ट ऑफ लक दिल से. अब जाके लंच करो, वापस आओ, मॉक टेस्ट पे बैठ जाओ. रात को लेट नाइट PYQ भी करना है. इससे ज़्यादा स्पीड से पूरा कोर्स कवर कर ही नहीं सकते थे. सो कॉन्सेप्ट पे थोड़ा ध्यान कम था. एपिडेमियोलॉजी में थोड़ा बहुत हमने देखा था, बायोस्टैट्स में थोड़ा. बट जस्ट कीप ऑन स्टडिंग. एग्जाम में जो आपके PSM के डायरेक्ट 30 क्वेश्चन आएंगे, 2 से 3 क्वेश्चन आपको बिल्कुल समझ में नहीं आएंगे. डोंट वरी, वो 2 से 3 क्वेश्चन आपका रिजल्ट डिसाइड नहीं करेंगे. बाकी 26 to 27 क्वेश्चन यू हैव टू अटेम्प्ट करेक्ट. सेम थिंग विल हैपन इन ऑल दी सब्जेक्ट्स. Don't worry about the questions which are extremely difficult. Think about the questions which are repeated, easy and moderate to attempt. No, it's not risky to give mock now. Mock दो, भूल जाओ. Don't look at the score. Mock को दो और just simply move forward. Right? Okay. So friends, all the best. Keep on studying hard. अच्छा लगा आज के सेशन में because almost all of you answered correctly. काफी स्टूडेंट्स नहीं भी लिख रहे थे. Those also I presume must have attempted correctly. सॉरी, यूट्यूब से आज मैं कनेक्ट नहीं कर पाया बिकॉज इट वॉज अ मैराथन सेशन. बट आई विश ऑल द बेस्ट टू ऑल द स्टूडेंट्स फॉर अटेम्प्टिंग और गोइंग थ्रू दिस सेशन ऑन यूट्यूब एज वेल. तो हैव फेथ इन योर सेल्फ, हैव ट्रस्ट इन योर कैपेबिलिटीज. इतनी मेहनत की है, रिजल्ट तो आएगा ही आएगा. सो ऑल द बेस्ट. पढ़ते रहो, पढ़ते रहो, पढ़ते रहो. ओके फ्रेंड्स, टेक केयर. दिल से शुभकामनाएं. ऑल द बेस्ट. मिलते हैं. नमस्कार, प्रणाम.